Sound test. 1, 2, 3. Sound test.
and it is wonderful to see everyone back, both in person and online, for day 2 of the Islamic Symposium, entitled Advancing the Clinical Practice of Islamic Psychology Through Education and Research. For the new ones joining in, I'm Sabika Shaban from the College of Islamic Studies, Hamad Bin Khalifa University. I do have to take just a few minutes to expand on the host organization. As many of you have managed to wander the Minaratain building, it reflects the college's very mission to infuse Islam across every facet of learning, leisure, and life in general. And this is also demonstrated in our postgraduate programs that are responses to the very real, very pressing issues of our societies. Whether we talk about Islamic studies and engagement with contemporary societal needs and popular and intellectual movements, or how we engage with Muslim cities, urbanist responses to growing refugee crisis, or the preservation of our heritage, and how we address ethical dilemmas that rise from the emergence of new technologies and AI, bioethics, gendered debates, arts, business, migration, how we shape the financial institution to be compatible with our Islamic values, and how we respond to urgent global trends of increasing humanitarian crises, language preservation, blatant human rights infringements, and so much more. So this will be our plug to please keep an eye out for our announcements in your inboxes, follow us on our social media channels, keep us just to keep updated on how you can engage with these various conversations with HBKU's College of Islamic Studies. And with that, it's an honor to welcome back Ustad Sayyid Jamaluddin Miri of ISIP to take us through the rest of the program today, inshallah. Assalamu alaikum.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum. Are you guys with us today? Is no energy or? Assalamu alaikum. Alhamdulillah rabbil alameen. Thank you so much, Sister Sabika, for your great introduction of Hamad Bin Khalifa University's College of Islamic Studies. It's a huge honor to be here, surrounded in a place where we're connecting our contemporary era with our sacred tradition. This is really something that is very, very beneficial. And throughout the presentations yesterday, we're looking at, as Dr. Shentuk often say, a rooted revival. And this is really something that you guys have achieved, even in the architecture. We were just outside in the courtyard, and it was really a rooted revival. You know, you see this modern architecture, and at the same time it's connected to our sacred tradition. And hopefully we all who are interested in the field of Islamic psychology can have that in mind, that Islamic psychology is not only talk therapy, as many of our scholars and practitioners are saying. Islamic psychology is architecture as well. And there's something sacred in architecture. And Dr. Rania, for instance, with her projects with Maristan, has spoken about this many times. The whole effect of how architecture helps you in your healing trajectory. And if you look at the modern hospitals today, it's almost like when you go there, you want to go back. It's like an asylum, right? So by bringing this rooted revival and bringing the holistic aspect of life within Islamic tradition, hopefully this could be something that could allow all of us to embark in a journey together where whether we're architectures or we're, homeopaths, or whether we are, dietitians or psychologists, can work to further advance the field of Islamic psychology so that we do not allow reductionism to divide us. Rather, we work with integration as a way to holistically reconnect with Allah subhanahu wa ta'ala. I was reflecting upon some of the talking points from our excellent presenters and scholars and practitioners yesterday, representing instead of representing. This is something very beautiful. Representing, right? We're presenting something that is already there, we're reviving it. And still we can represent as well. But we don't need to represent in a nafsani way, right? Like, I am from this school, you're from this school, let's battle. You don't need to do that, Rather, we represent and then we represent the multiplexity of Islamic psychology, being good rather than feeling good, right? This is all from Sheikh Amin, if I'm not mistaken, by the way. But all of the scholars said a lot of amazing things. And that took me to the whole aspect of secular spirituality. Because if you look at secular spirituality, it's all about, be good. Feel good, but don't feel God. Don't connect to God. God is taken away from the equation, right? So Even though there is a lot of good streams in modern psychology as well, we actually benefit from third wave CBT or positive psychology. The whole Tawhidi paradigm does not exist. And that's where Islamic psychology comes in. So these are some of the talking points. I'm sure you guys took a lot of talking points, so please share it with each other. Please connect with one another, because it's through sohbah and companionship that we build resources for the future, inshallah, as we're all part of this movement, inshallah. All right, welcome you all again from the behalf of Hamad Bin Khalifa University and College of Islamic Studies, and in partnerships with the Khalil Center, the International Association of Islamic Psychology, and the International Students of Islamic Psychology. We welcome you all to the day 2 of this beautiful symposium, Advancing the Clinical Practice of Islamic Psychology Through Education and Research. We still have the translation for all of you who would like to listen to the talks, whether in Arabic or in English. So take your headsets, please. You can get it from the information desk outside. The QR code, if you guys want to have access to the booklet, it's here. So please do scan it if you do not have access. The logistics is the same as yesterday. We will have some breaks for refreshments and for lunch as well. And the toilets is on the left side of yours. I think that's it for now. And once more, special thanks to the organization committee and specifically those that are behind the scene, like Sister Sabika, Esra, Alia, Mediha, Dania, and Fatima. So after lunch, as we highlighted yesterday, we will have a roundtable discussion, inshallah, for the scholars and the practitioners and those who are invited. So for all those who are invited, please stay here after the lunch and do not go anywhere. Jazakallah khairan. So without any further ado, let's go to the first panel, all right, of this day, the day 2. It's panel 5, which will have the overarching theme of applied educational perspectives. And the first presentation will be application of a model of knowledge integration, mechanism for the decolonization of Western secular psychology knowledge with Dr. G. Hossein Rasood. The presentation 2 will be bridging perspectives, integrating contemporary and Islamic psychology in university curricula with Dr. Muhammad Tahir Khalili from Pakistan. Both of these scholars are amazing scholars. And finally, also from one of the great scholars, examining practitioners' educational experience in Islamic psychology training program, a mixed method feasibility study with Dr. Abdullah Rotman. And I want to give shout out to my classmates, actually, Shaista, Dean, Zuri, Mamat, and Imran Khan for also being part of that paper. And finally, we have a presentation 4 as well, with Dr. Wahdad Görmez from Turkey, Islamic Insights in Developmental Psychology, Enriching the Framework of Human Growth. And our moderator will be Dr. Hamada Hamid Al-Talib. So without any further ado, Dr. Hamada, the floor is yours. Jazakallah khairan. Rounds of applause.
Bismillah, alhamdulillah, wa salatu wa salamu ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you again to our hosts and our organizers and presenters for all your hard work behind the scenes. We know how hard it is and challenging it is to run a conference, so thank you for all your hard work. So the way I was invited initially was a discussant. So I look at myself more of a discussant than a moderator, and that means I'm going to discuss and help frame the panel very briefly. So I'm going to do something a little bit different. You all have access to the booklet, so you can read the details of the bio sketches of each of the panelists. Briefly, the idea of the whole is greater than the sum of parts was attributed initially to Aristotle. The whole is greater than the sum of parts. So when you look at our panel, don't look at the individuals, look at it as a collective, as sum of parts. And that concept, whole is greater than the sum of parts, was embraced in different sciences, including usul. It was embraced in social sciences, in the physical sciences. There's even a systems science, and there's complexity science that works with this idea of the whole is greater than the sum of parts. And mathematically, these things have been calculated in different settings, whether it's in a social setting, in a physical setting, that when you add these sum of parts, they don't add productivity linearly, but exponentially. So I'm going to offer 2 challenges. One challenge to the group is, if you think about the whole, if we work as a group, your productivity, your activity is going to be exponentially more productive and meaningful and valuable, inshallah, much more barakah. And so I challenge all of us to try to gather, to find a few other people to collaborate once you leave the conference. It's great for us. We're all inspired by our colleagues and our scholars. But what do we do next? And so my challenge to all of us is find 2-3 people to say, we're going to work together this year into next year and further on. That's challenge number 1. So in terms of the introduction, and the challenge number 2 is to the panelists, in terms of the introduction, you can all read the bio sketches. With us, if you take the whole, we have over 100 years of experience in clinical leadership, in academics, in clinical care. 100 years in this panel. We have dozens of textbooks and hundreds of academic articles in this panel. If you took this panel and put them in a department, they could lead a department, this panel. Each person would bring 2 or 3 other of their top people. You'd run a department. It would be the premier department. So the topic today is applied education perspectives. Now, when I think about academia, I'm a neuropsychiatrist. I'm also in public health, and I live in the space of academic medicine. And so when I talk about academic leadership, or when I think about academic leadership, I'm very aware that all of these members of this panel are chairs of the department. Also, all of them are clinicians, so they're grounded. They're grounded in what the patient experiences. That keeps them honest. They're all clinicians. That doesn't pop out in the bio, but that's something I want you guys to remember. That they're clinicians, they provide care, and they also has professional experience. Some of the skill set of being a clinical leader is recruiting faculty, developing faculty, having strategic vision of your department. Where is the department going? And this conference, we just don't have the time. We're trying to bring in so many people. You don't have the time to get all these kind of pearls of wisdom from 100 years of experience. Each one will have 15 minutes. But I want you to remember that the whole is greater than the sum of parts. My challenge to the faculty is that because they have such limited time, they have to choose what they're going to say. And the pattern from yesterday is to keep it very high level. And so because the topic is applied educational perspectives, and because all of these gentlemen have extensive leadership experience, I want them to give one concrete recommendation for Ali Habibi. Where's Ali Habibi? Ali Habibi gave a kind of aspirational vision of, okay, if I had a program in Islamic psychology, this is what it would be. These guys have been doing it for decades, 100 years. And so just give me one concrete recommendation for Ali Habibi. And after 1, 2, 3, 4, you have 4 steps closer to achieving that goal. Okay, so without further ado, we'll start with Dr. Hossein Rasool. Again, you can read his bio. A thought leader in Islamic psychology, also a clinician for 30 years. And so, Sheikh, Dr. Rasool, do you want to speak over here or the podium? Okay, yeah, you're welcome to go. No, we're not going into your few minutes. Yeah. Thank you very much.
What do I do? Can use both. This one, and we can use keyboard. Let me try. Okay. Start. Okay. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام رسول الكريم وعلى آله وصحبه ومن سن بسنة يوم الدين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. السلام عليكم ورحمة الله وبركاته. Anyway, to cut short, thank you very much everybody who invited me. So 1 minute gone anyway. So I shall my presentation is hope I try to cut it short a little bit. Anyway, it's quite a long title. Basically, it's about how do we integrate Islamic ethics, Islamic science, Islamic studies in the curriculum. I had a big problem because when I was given the task in Pakistan the remit was looking at undergraduate course and how you're going to integrate, Islamic studies within the psychology curriculum. I searched for everywhere. I needed help. I learned about Islamization of knowledge. I even did a course on knowledge integration from IIIT, the IKI Academy in Georgia. I was looking at, how we're going to integrate knowledge, in fact, Islamic knowledge within the curriculum. Now, I want to talk to you about an analogy which is called the upstream, downstream analogy. We are focusing very much on the continuing professional development of practitioners. So basically, if I use the analogy of the river, upstream, downstream, we have a lot of people jumping into the river, and they're drowning. And then as educationalists, clinicians, we're trying to rescue them. Why not teaching them to swim in the first place before they get drowned? Okay, Allah decide who drown, who doesn't drown. That's. But what I'm saying, what I'm trying to say is that we need to look at the initial education and training of our future students so that they don't get embedded or acculturated with secular psychology. And then what we are doing now is we are taking the end of it. We are catching up so they don't drown anyway. So the project I had in Pakistan is looking at undergraduate course in psychology. We didn't want to call it Islamic psychology because people won't get a job, even in an Islamic country. That's what I was working for the last 3 years. Like I say, my problem was, how do you do it? I look everywhere, I look at the literature. No, how? No, there's no process. People talk with a lot of paper on decolonization, deconstruction, and integration, but how do you actually, what's the process? I want to know the process, how to do it. I wrote a paper back in 2000, and I can't remember the date anyway, I'll just move on a little bit. And where I look at the existing program, short course, long courses, and I found there are 3 different types. One I call the bolt-on model, where you do everything else and then you add a module of Islamic psychology at the end of it. Or you do a sprinkle model where you sprinkle a bit Islamic verses here and there in hadith and you make it become Islamic, inverted commas. Or the third one is the integrate model. Now, as far at that time, most of the courses went between those two, the first two, the sprinkle and the. There was no really, from my experience, again, I may be wrong, but my experience, what I saw, what I observed, was that there was there was some sort of integration. We're getting there, but we are still a long way towards full integration of that anyway. So I basically thought, okay, I don't know how to do it. Let me think about how I would do it, out of the blue. It's not evidence-based, nothing. It's just purely from, I'm using my hat as an educationist there anyway. So I developed some sort of model, this particular model, you can exit. It's circular, but you can exit and come out anytime you want anyway. And so we start with the planning stage and move on. Now, the planning stage, basically, you have to operate the whole system in a very systematic and logical way anyway. And the planning stage is about setting groups. Again, I'm talking about undergraduate psychology courses there, not postgraduate courses. You can still do that. So you need to set up a number of working groups. Different subdisciplines of psychology would have their own particular work group, which is going to be overseen by some sort of faculty group anyway. And from there on, you start what I call mastering. Now you have to master the whole curriculum. You have to be the gestalt there. You don't look at a particular, you don't look at child development, but look at child development, as a whole with the whole holistic program anyway. So you have to master not only the psychology program, the problem we have in most departments of psychology. What about Islamic studies? Now, this is where you have to have interdisciplinary, contact and collaboration. You need to have the education department. You need also to have, like what the model they're doing here is excellent, alhamdulillah, anyway, I'm glad. That's good practice. That's what I call good practice, because I know I was in trouble of saying that. Most clinicians are not educationalists. We think we are, but we are not. So bring in the education department, bring in the Islamic studies department, and the psychology department, you have a connectedness, integrated program, because why people study education up to PhD? If we all clinicians, we know about education, we don't need these people. So you need to bring all these together and collaborate so that they can give the educational principle, the curriculum design, the curriculum development, what model you're going to have, what philosophy of education here. When you look at most of the courses we have, what is the philosophy about those courses? What the curriculum design and development? And when I look at them, sometimes there's no what we call constructive alignment. The learning outcome doesn't match the content or the methodology or the assessment. That's another issue. Let's move on. How much time I have left? Now to deconstruct it, it's a big word, but basically it's about, we need to broaden our knowledge of the landscape of the subject matter of the theme for each of the psychology disciplines. So that's why we have specialists. We have people dealing with child development or biological psychology, whatever it is in undergraduate. They would be able to look at the program as a whole and see how they're going to construct. And then you have, that's important, curriculum mapping. You're going to take themes. Curriculum mapping is basically, it's a reflective practice. It's a process that we try to identify content, method, and assessment. And you can do all sorts of things like curriculum maps. This is a very practical thing, not a theoretical thing anyway. You need to like concept maps. And I tried to do one. I think I've done one. Basically, I know it's handwriting there. But this concept map was based on Maqasid methodology. Yeah? If anybody don't know about Maqasid methodology, it's from just an order, Maqasid methodology. I use his methodology of trying to, this was a very simple exercise anyway, of trying to use all these elements to try to produce some sort of mapping, of this anyway. We could do that with any subject. This is one example of mapping, okay? It's not the, So you have to look at mapping subject, mapping theme, how they and then connect them together. I'll move on. The other thing is we need to have the scope or level. We need to make decisions about, the breadth of knowledge. How much should you teach? But also level. Is that level 1, level 2, level 3? Because you need to have prerequisite. If somebody can't do biological psychology if they have not done introduction to psychology. This is that's what I'm saying, level, is that there should be some sort of educational prerequisite before they move on. It's like from being an apprentice to being mastering of skill. So a different stage, different level, different skill as they go along, and so forth. And that's what we mean by scope and level. If you read my paper on Islamic Studies, which I wrote 2021, something like that, you have all these in there anyway. So that's what we mean by scope and level integration. And one thing we don't do, and I think there's a dichotomy. We are producing all these courses, but has anybody done any training need analysis? Are we matching the content, our course, to the needs of the practitioner? Because what's going to happen, I've seen it happening with mental health, is that there will be a gap between what you teach And when they go to the clinic, when they go there, it's a very different world. Yeah? So we need to have this in mind to make sure that what the content of the curriculum is matching the needs of the practitioner there. Otherwise, we're going to follow the same problem with addiction, with mental health, where what we teach in the college, university, doesn't match the needs of the practitioner. So we need, maybe sometimes you can't do it, it's practical, is to look at training analysis, and this is just a process which you go through. Finally, there are three main criteria for knowledge integration. One is the efficiency of it. Yeah. How efficient it's going to be. I think we need to evaluate that anyway. And also, we need to look at the scope of integration, like I did, the breadth of integration, and also, we need also to have some sort of flexibility integration. But what came out of my research when I did, there were three things which I think need investigating. It's good for PhD or master's degree. Is knowledge transfer. Okay, you can integrate beautiful curriculum. You can make everything nice, everything embedded and so forth. But how do the teacher or the lecturer or the practitioner apply in clinical practice or in education practice? That's the problem, knowledge transfer. What I found is that there were three problems. One to do with role legitimacy, one to do role adequacy, and one to do with role support. Now, role adequacy means that it pertains to the extent to which the person, the practitioner, feel that they can do it, they are capable of doing it. And then you have the role in legitimacy. Is it my role to do that? I haven't thought about it. How do you expect me to do that? So there's also an organizational problems which do with role support. If people don't have support from the organization and resources, then it will be very difficult to transfer that knowledge, whether it's a clinician or whether it is but also, we teach about integration. How do you integrate, again, the same problem, Quranic verses or hadith in our life? It can't be mechanical. You can't teach people, you have a patient with anxiety state, you say, no, you can't say that. This is very mechanical. So we go back to having knowledge of Islamic studies. We differ in terms of how much you have, but nevertheless, we all agree that people need to have Islamic studies, Aqidah, fiqh, Sirat, and so forth, and Hadith as well, before they can practice as a clinician. I'll stop there anyway. Thank you very much. Jazakallah khair. Pardon?
You have 2 minutes bonus time left. So you 1 minute.
Okay, so my takeaway is that we need to really look at, to match needs of practitioners, we need to really look at our program. Are they meeting the needs? I know Dr. Rahman is doing some evaluation of the course and so forth. We're going to find out more about it later on. But it's matching the needs of the practitioner to what we are teaching in our establishment. That's my takeaway point.
Jazakallah khair.
Thank you very much.
So as Dr. Muhammad Tahir Khalali comes to, do you want to speak from there or from the podium? Whatever you prefer. From there, fine. Yeah. So I counted, by the way, at least 8 concrete example steps. So Jazakallah khair for that. Yeah, this side. Yeah, he's coming. So Jazakallah khair for that. And as you can see from the bio sketch, Dr. Muhammad Tahir Khalili is Professor of Neuropsychology, Dean Faculty of Social Sciences, and Shifa Tamir at Maladi University, Islamabad.
Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wa ahlul uqdatan min lisani yafqahu qawli. First of all, thank you very much, Dr. Huma and Dr. Rajab, for organizing such a wonderful event. I think this is a very exciting moment that we are here. And this is very much closer to my heart because I usually talk about integrating, and I usually educating that Islamic psychology should be a part of the mainstream psychology. It should not be separated, segregated from the mainstream psychology. And for this, I am working for the last more than 10 years. Even in the papers, in the researches, I am trying to adopt the evidence-based approaches indigenously to our own culture and with our own religious perspective. This is the main purpose of our institution where I used to work. That department was established by the late Professor Malik Badri, I mentioned as well. Allah may give you high place in Jannah. And then in 2011, I joined Department of Psychology, International Islamic University. There, I introduced the Islamic psychology course. But historically, in Pakistan, the Muslim psychology course, they were taught in the university since 60s, and then in 80s, they were approved by the University Grants Commission, and later Higher Education Commission endorsed those courses. But later on, we changed the title, the nomenclature of this course from Muslim psychology to Islamic psychology. At the PhD and MS level, it's compulsory, and at the BS level, it is optional. But majority of the students, they takes this course at the BS level as well. I must acknowledge the co-author of this paper, Dr. Fatma Khurram. She is a clinical manager, and Sayyid Ayad Zainab, a PhD scholar, Musira Ayman, a lecturer, and Warda Ashfaq, a lecturer, and Dr. Tamkeen Salim, HOD of the psychology department. I won't go in detail because you all know the perspective that contemporary psychology is rooted in the Western model. And that definitely, we don't have any shame or any regret because it's a human experiences and they worked a lot. We acknowledge their contribution. We will be honest to acknowledge their contribution, but at the same time, we also need that. I work in Ireland for 12 years in that system, and I work here back home for a long time in my own culture. There is a big difference. When you're doing practically psychotherapy or you are practicing, then you can enjoy the treatment program there. But when you borrow the whole things and you bring to your own environment, it's not possible to implement that because there are plenty of things. For instance, like you cannot sit alone with a woman in Pakistani culture. That is prohibited. Then how you can modify this? How you can get idea of her illnesses? There are plenty of this. Is just a very simple example. Then we need to have this Islamic and cultural perspective integrated to the Western or the modern, the contemporary psychology. I would say the contemporary psychology because if you look at the Western model, then that is, don't take me wrong, that is the model of the minority. Majority of the population, they are in the Asia, in China, in Pakistan, Bangladesh, subcontinent, even in the Middle East. Their representation is very less. It is a very small population they are dominating. Initially, they physically dominated us in the form of colony, but now, through the social media, we are also influencing. We are not free now. There is no freedom, at least academically, because they are still influencing our mind and our ideas through the medias and through the social contexts. But we don't have any way how we can, if we get isolated, then we will be isolated. We will protect ourselves, but we will not be in the mainstream. But if we enter in the mainstream and if we introduce this Islamic thoughts, Islamic ideology, Islamic principles, and we transform the individual. It's not just the teaching, just to transform the individual to be a psychologist, a very good psychologist, he can administer MMPI, he can do any CBT or community reinforcement approach, but at the same time he is a very firm Muslim, a firm believer in Tawheed, and he has this principle, and his work is grounded in Islamic teaching. Then we can work hard with the mainstream psychology, and then we can introduce. In this study, I felt that we need to have Islamic psychology in the mainstream. If we segregate this, there will be plenty of problem. There will be resistance, hard resistance. The people will not get job. Some people, they are missionary people. They can do, they are not doing for the sake of the job. But majority of the people in our countries or in another country, they do education to get a nice job. Then I think through this ideas, we had the aim of this study to explore experiences of academicians engaged in integrated Islamic psychology and contemporary psychology within university curricula. We chose two universities, International Islamic University, Islamabad, that is a public sector university, and Shifat Amir Millat University, that is run by a foundation. We adopted the qualitative method where we developed an semi-structured interview and depth interview through literature and pilot study. We took a sample from the two universities, that is the 15 academic teaching faculty, 8 from the International Islamic University and 7 academic, like starting from lecturer to professor, that is from the Shifat Amiri Millat University. We also had the inclusion criteria, those who are teaching psychology for many years, but they have this Islamic psychology background. Particularly, majority of them, they attended the Abdullah Rothman and Rashid Skinner course and Dr. Human and Dr. Fahd Khan courses. But in addition to that, they also studied many courses and many books of Islamic psychology. And one advantage was there that we had a very good faculty of Usuluddin. And they were very cooperative, and we had a close liaison with them. They guided us from time to time, and even they participated in our research, and we have some joint collaboration and research paper on different topics, on a range of topics in psychology. We developed this interview guide, and we got the informed consent, and then we collected the data, and we used this thematic analysis using InVivo 12+ software. Just to cut the long story short, because of the paucity of time, I won't go in details. This is the demographic data. The age range from 30 to 45, 13, 87%. It's good that these people are growing, and in future we have this coming Islamic psychologist-oriented individuals. We have a male 4, but fortunately female are more than the male. 10 lecturers, they are young people, they will go further, they will study more Islamic psychology. 1 assistant professor, 3 associate professor, and 1 professor we interviewed, and this is the years of experience of these individuals. We looked at these areas, for instance, like Islamic psychology as described by academicians, because there is a differences. Some people think, like back home, we have this thing, and there is a discourse on it, that Rohani Bimari, but some people say no. The majority of the scholars say no, there is no Rohani Bimari, there is Nafsani Bimari, because Ruh, that is Amri Rabbi, we have little knowledge of the Ruh, but we have to deal with the Nafs, the Nafsani Amraz and Nafsani Bimari mean disease. That is the Rohani Bimari, they are using the terms in Urdu. Second problem was contemporary psychology as recognized by academician, because most of the academicians, they think that if you have a degree in the contemporary psychology, then you can survive, otherwise you won't survive. And Islamic psychology in relation to the contemporary psychology, and then what will be the how we can looking forward to integrate Islamic psychology to the mainstream psychology, and the barriers and facilitators. This also you will find some barriers, but there are some facilitation as well from some part of the institution, and future recommendation. The first one, the academician describe Islamic psychology as a holistic approach. They think that we should focus on the self, and they translate self as a nafs in Islamic psychology. For ruh, they use the word soul, because they didn't use the word spirit, because spirit has some negative connotation. They say that we also need to have this uniform glossary, that we should use uniform words throughout, and they are trying that why we shouldn't educate for the uniform terminology, uniform glossary. Some people use soul for the ruh, some people use soul for the nafs, but the main focus they showed that it will be nafs. And they think that our heart is connected to the ruh, the light, the divine light, and the heart has an access to the nafs ammara, and shaitan has access to nafs ammara. And they think that if somebody does something wrong, then there will be a black spot on the heart, and we need to work on the nafs lawwama. Nafs lawwama will be the focus of Islamic psychologists, and they will keep activated nafs lawwama 24 hours. This will do the cleansing, that will make cleaning all the time, and then we can get nafs mutmainna, which is the ultimate goals of the human being. And for that, they are trying to develop the model how they can keep activated the nafs lawwama to keep all the time cleansing and cleaning and removing the dust from the heart. Second is the contemporary integration of the contemporary. They also have the view that we need to study the contemporary psychology. We shouldn't be behind in the contemporary psychology. We will know MMPI, we will know any other test, and even being a I'm practicing as a clinical neuropsychologist, there is no differences. Like suppose if someone has traumatic brain injury and he has developed some cognitive deficits, then there is no differences with the other people. They have done a great job, and then you can utilize that. And that's why they said that we will be in the mainstream psychology. We will have this skill and this model, but we will also have the Islamic psychology as a prominent subject in our syllabus. Then they tried to integrate the Islamic psych, and we did this experiment. Now, some of our students, they have completed their PhD. One has developed a very good scale that is called Melodies of the Nafs. We identify 12 melodies of the nafs. In Urdu, we call uyub. Probably it's also an Arabic term, uyub. Melody 1 is aib, and plural is uyub. Like hasad, jealousy, ghadab, anger, ostentation, riya. These are 12 melodies which were identified. And they applied on the standards which you can do for a test construction or a test development in psychology. And we developed this skill, we generate the pool of items, and then that was reduced by a committee approach. And then we determined the psychometric properties of the scale. It will be nearly published. I will share with all of you, and you can utilize to assess the melodies of the nafs. I think my time is up. I will just go for the recommendation. At the end, I will give you one recommendation. And that recommendation will be that Islamic psychology should be a part of the mainstream psychology. It should not be segregated. Like the way in the colonial time, the British did, that they make madrasa for the teaching Islamic religious teaching and schools for the for the worldly things. Then I think we shouldn't do this separation, but we should be integrated in the mainstream. Thank you very much. Thank you very much once again.
Next up to Abdullah Rothman, who everybody knows,
Doesn't need
thought leader in Islamic psychology. Are you going to speak from there or from
All right.
wherever you prefer?
Bismillah.
Go for it.
I'll do it from here. Can I have that?
Oh yes, please.
Let me just make sure it's working. All right. Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Rajab and Dr. Human, thank you so much for having us. And this is, we're behind you in this effort, and we're all invested in your success. And your success is our success, inshallah. So I want to jump right in so I can maximize my 15 minutes. This is what I intend to cover. So I want to talk about a study that we did, but I'm going to contextualize it in talking about the centrality of the heart in our conception of Islamic psychology, how that impacts how we're training practitioners, and then using the CMC, the Cambridge Muslim College diploma, as just sort of a case study for this, and a study that we did called Ruh IP, Research Understanding the Heart in Islamic Psychology. So this is out of our Islamic Psychology Research Lab at CMC, and we're really focused primarily on investigating principles of Islamic psychology, so not so much theory, but putting that theory into application and understanding therapeutic mechanisms and change specifically having to do with the spiritual phenomenon. And so there are lots of different approaches, and we've covered some of them in this conference, and there's approaches to Islam and psychology, and so what I want to talk about is just the assumption based on Professor Malik Badri's work of really saying that we should be doing this from the ground up as a model of Islamic psychology, differentiated from blending in Western paradigms. So understanding the human being as the Quran lays this out, and not necessarily a comparison or overlay with a Western one. And there's lots of different models for approaching this. Essentially, these are interpretations of what this and synthesis of what this Quranic paradigm is. This just happens to be my version of that and an attempt in this model. But in all of them, it's pretty clear that the heart, the qalb, is central. It's the central aspect of the human being, and that we're talking about not just the nafs, but the aql, the ruh, the qalb, and the qalb and the ruh are always getting mentioned. Everybody seems to agree that these are fundamental aspects. And that it is an integral picture of the human being. And so, however, it seems that we tend to, because we're still in this Western academic milieu of science, and we're talking here specifically about clinical applications, we tend to base these discussions in these milieu that are inherently have an epistemological bias towards what can be measured. And fundamentally, when we speak about the ruh and the qalb, these are aspects of the ghaib, the unseen reality of the human being. And so most of us are trained clinicians, trained in the West. That's how we got to have PhDs in these things. And we happen to be, all of us, whether we realize it or not, are contemporary human beings. And whether we like to admit it or not, we're influenced by Cartesian dualism and materialism. And so we have this tendency to focus on cognitive behavioral aspects. And so in this model, looking at from the sort of middle line there up, and I indicate this being a sort of a Western approach, a Western model that's based on this notion that there really isn't an unseen reality, and so we only deal with the aspects of the human being that we can understand and measure. And that maybe we talk about emotions, but I would argue that emotions are sort of a surface level of certain dimensions of the qalb. And so then people say, which means that we're this whole entire sort of darker parts of the iceberg that are sort of shrouded in mystery become avoided, right? And they don't disappear. So when we have a client in front of us, they still have a qalb, they have a ruh, they have a spiritual reality, but we may or may not be dealing with the elephant in the room because we feel nervous about this. And so people say, how do you actually engage the qalb in a clinical aspect, in a clinical engagement? And interventions, I find that talk about the ruh, like ruh interventions, tend to be acts of ritual worship, which I would say are a little bit more behavioral, and we're not necessarily talking about maqamat or ahwal, or spiritual states. And so we need to acknowledge these things at the very least, and I would say learn to move towards a place where we can increase people's competency in dealing with the reality of the spiritual state of the human being. And so the focus on this conference is on education and training practitioners to do Islamic psychology. And so how do we get trainees to engage in this experience of aspects of the whole self? So in this research that I did in the scope of Islamic psychotherapy, this model is sort of distinguishing it from religious and spiritual guidance. So, and as you can see, participants were saying that in their practice of doing this work of being an Islamic psychotherapist, their conception of the person is centered in the heart, and so therefore the focus of therapy should be in the heart. And evidence suggests that the engagement with the spirit, and therefore spiritual guidance, to some degree is inevitable. Because if we're really doing Islamic therapy, rather than just calling it by name and doing the sprinkling approach of names, then what is Islamic? It's this notion of the whole being in surrender and in submission to Allah subhanahu wa ta'ala. And so if we're seeing the client as a soul with the ruh and the qalb, and we're not avoiding that reality, then it sort of changes the CBT dominant approach of talk therapy. We have to recognize that the soul that we're talking about has a reality of being embodied. It actually exists here in the physical body, in the jism. And so this training practitioners in this new space of Islamic psychology, we need to make sure that they're comfortable and confident with their own inner reality, their own qalb and ruh and spiritual states. And as Dr. Salimi said yesterday in his talk on ethics, we need to work on purification. And it makes sense talking about it in a conversation on ethics because it becomes an ethical obligation when we're starting to introduce the spiritual reality more than just religious discourse. And so we need to get our practitioners to be working on their own inner self. And so this model was mentioned a couple times yesterday by Dr. Rania and also by Dr. Khalid. And this Venn diagram, this space where the Islamic therapist exists, is it becomes incumbent upon them to do this purification of the heart. And so how does that impact our discussion on curriculum and program development? It's not only about book knowledge. We can't only be talking about history and concepts and theory and rational proofs. And so I guess my question is, should these Islamic psychology programs only be ta'lim? Or if we're approaching this education as Islamic, rather like the Islamic as an adjective to education rather than the content of which we're teaching about Islam, then do we not need to incorporate tarbiyah? And the tarbiyah is not only a good model of pedagogy, but it is an ethical obligation as we're sending practitioners out into this world. And so this is how we designed the program at Cambridge Muslim College to be both a balance of ta'lim and tarbiyah. And so I won't go too deep into the ta'lim part because I think we all agree We've already had presentations on curriculum. We've talked about theoretical frameworks. And I think we agree that it's based on the Islamic sciences. It's based on this Quranic paradigm, the work of early Muslim scholars. So let's look at the tarbiyah. So yesterday, at the beginning of the day, Sheikh Amin said there has to be tarbiyah and tazkiyah as a wing within Islamic psychology education. And he even said this idea of procuring knowledge from the other world, which is inherent reality to Islamic epistemology, that there is knowledge beyond just what we learn. And so these three basic elements are aspects that we've incorporated into the program. Suhbah, not just being people coming together, and in this case, it's online, so the suhbah is in the grid of Zoom, but we have these hearts. Why? Not because they're just putting the icon. We actually do a lot of work cultivating this space. So what we're doing from the very beginning is building what we call designed alliance so that they feel safe, they can be vulnerable, they can be a place of growth, and their suhbah with their instructors. And so they can, and this is based on Al-Ghazali's rights of brotherhood, is that it's not, you wouldn't do this in the public space, you wouldn't share your faults openly, but you have to have these pacts in private to be able to do this growth work internally. And then muraqabah, here we can call this, also the word tafakkur, and Dr. Salimi was saying that we need to have contemplation in the program. And so Dr. Malik Badri's work on contemplation was fundamental to this. Dr. Malik specifically advised me on how to do this. And we're not talking here about tariqah-based prescriptions of adhkar. It's not specific muraqabah from a Sufi order. As Dr. Khalid pointed out, that would be an ethical issue. This is just adi, connecting with the being, with the physical being. And this is not, we think this is scary now because we're so disaggregated as contemporary people that we're all in our heads. And so the idea of connecting with the heart, connecting with the body, taking a breath, and connecting in this process of muraqabah, which just means watching the self internally, it's not a big deal. It's something that we need to be more comfortable with and train people to be able to do if we're talking about the whole being, the integral self. And so we're teaching the students throughout their program to be comfortable with their inner world. So we use these practices as laid out by Ghazali. He gives steps how to do this, as well as al-muhasabi. It's not rocket science, and it's not shrouded in mysticism or necessarily these deep secrets. That is something, but this is not what we're doing in the program. And then muhasaba, we have them do a journal throughout the whole place. Sometimes they're given guided prompts for the journal, and sometimes it's free for them to process and reflect. And we give them guidance on that also from Al-Ghazali. So in this study that we did, yesterday Dr. Human was talking about different methodology, and he talked about HADS. And so our sort of educated guess or prediction in this was that their students would have a transformative experience from this program, but we didn't want to assume that, and so we didn't set out to measure their transformative experience, but rather measure their experience in the program. And so how might this inform a collective understanding for IP training and education? And so our hope was to use this data to understand aspects of personal transformation and sort of empirically capturing phenomenological changes and highlighting domains of importance in the context of IP. So I'm just gonna, and so we did this as a feasibility study. So like the methodology Dr. Human was talking about of tajraba, experiential trials, we're seeing, does this work? We're trying it out. And so this is, I wanna present just some of the findings in my 1 minute that I have. And we did a quantitative study and a qualitative study. So we developed these rulers to measure their experience and their confidence. So experience in their own self and their confidence in applying that with clients. So here we're gathering data about their experience of their whole being, jism, nafs, aql, qalb, ruh. Then this was some of the results that we found that there was a general decreased trend in cognitive and emotional dimensions of experience and a heightened trend in observed bodily sensations and experiencing of one's heart, qalb and ruh, from a baseline. But we observed an overall increase in experiences of the whole body by the end of term. So not separating the qalb, the aql process with the bodily part. And then the confidence ruler aimed to experience of how the experience of the self can parallel to how this impacted their work with clients in the whole self-experience. Because as Dr. Rasul is talking about, is we need to make sure, is this working? Is the training going to be applicable to the clinical setting? So we didn't observe much decrease in the participants' confidence in addressing the 5 aspects of their clients. Unlike the self-experiencing ruler, participants increased in their confidence in addressing the aql with clients, even though they themselves might focus their attention towards the aspects involved in influencing the heart. So they're able to balance this, and it demonstrated that there was a clear transformation where the practitioners were increasing their confidence of applying this in their work, and a key aspect of the work was through their reflection and personal growth. And then the Muhasaba journals, I'll just, a couple more slides and I'll wrap this up. The qualitative piece, we looked at their Muhasaba journals, which were free form, and we were able to determine, do a qualitative study and determine these themes from them. They reflected development and growth in a linear manner with greater integration occurring in the later parts of the program. And an ongoing sense of overwhelm and anxiety and uncertainty was present throughout. It's not that they're spiritual bypassing, they're integrating. So they're able to deal with their tensions and their anxiety, but the intensity was being able to be managed. And so this seemed to indicate that engagements with cognitions and somatic experiences and behaviors, as well as the qalb and ruh, rather than a separation. So it's seeing the whole self. And so considering the qualitative and quantitative data together, it was clear that it doesn't mean that they're avoiding these things, but like I said, a greater awareness. And it was really helpful to have the quantitative and the qualitative data together to understand what was happening in there. And it gave them a broader confidence in putting this with their clients. So just in conclusion, obviously, again, Dr. Human talked about tawatur, sample size. This is always an issue. We're just starting, getting this going. It's a feasibility study. We need more size of subjective reports. And hopefully this small feasibility study will present some hope of both encouraging the development of IP programs to engage tarbiyah and tazkiyah, as Sheikh Amin said, as integral aspects of curriculum, not just the ta'lim. And inshallah, this can show some precedent for how we might be able to even measure the trainees' progress in these transformational states. And I just want to thank my team, my co-authors. These are all graduates of the Islamic Psychology diploma. They were in the first cohort. Jazakallah khair. Thank you so much.
Jazakallah khair. Very important research. I appreciate your work. If you had one concrete advice for a new program based on your research.
Incorporate tarbiyah into your Islamic psychology programs.
Jazakallah khair.
Sorry. I think.
Okay. Now we end with our final talk by Dr. Vahdat Gormez, a fellow psychiatrist. We will talk about development, his expertise in child psychiatry. We'll talk about developmental psychology and attachment in Islamic perspective.
Assalamu alaikum. Right, so I haven't spoken in Islamic conferences before, and this is not my field of knowledge and experience, I must admit. So I am a psychiatrist, and I specialize working primarily with children and young people, 0 to 18. And if they have neurodevelopmental disorders, that needs to follow up maybe age 20. In the last 10 years, this has been my primary work. But when someone comes to you, a young person or a child, oh, so okay, this one, sorry, yeah, this time. Okay, so comes to you with a psychopathology, whatever the name is. The inevitable question is that whether this could have been prevented in the first place. Whatever that we could have done that could have prevented this person, this family being so dysfunctional. And as we know from the experience, from the theoretical knowledge we have, is that you can't attribute the current problem to a single triggering factor, even if it is trauma. We know that people are subject to very severe traumas, natural or man-made, and not everyone responds in the same way. Okay, the whole family goes through this earthquake, for example. Not all comes to us as patients or as clients. Okay, PTSD is the diagnosis that you can attribute the most power to the causing factor, but even in that you can't explain. So that is more. So. In Islamic psychology as well, that I haven't actually heard much about the scholars talking about the theories of developmental psychology that really must be revisited. So my talk will be just briefly go through just briefly some of them that we really need to rethink, rewrite, reinterpret, and mainly focusing on attachment theory from Islamic perspective. And as I said, my knowledge and my presentation based on what I have read. I haven't done any study, and no study has been done on attachment theory anyway from Islamic perspective, especially from some perspective, especially studying on whether, for example, the child's attachment behavior with the parent corresponds to the parent's attachment to God in Christianity or to Allah subhanahu wa ta'ala, whether that corresponds to each other. Hasn't been studied anyway, but there is a lot of work needs to be done in the field, in the realm of developmental psychology, undoubtedly. So as a psychiatrist, when we try to understand or treat a case, we follow the classic biopsychosocial model. It's a really powerful model that, so we understand the biological components of the problem before us, the psychological and the social. So, of course, there was a need for spiritual or religious factors as well that has been incorporated. And as you know, if there is a need, for people anywhere, it is the U.S. that would provide it to us. So now American Psychological Association has, as you can see, put a lot of importance and stress on publishing new journals about studying religion, studying spirituality. So if there is need for religion, it is them who would provide anyway. So that's biopsychosocial model of it helps us to understand why the problem has started in the first place and has continued so far, and also design our treatment program planning as well. But our understanding of psychopathology is based on this theoretical frameworks related to the developmental theories in psychology. For example, the Freudian psychosexual development. We shouldn't think that it has been outdated and it doesn't have influence anymore on any of us. It does really. It affects art, it affects literature and cinema and all fields of life. And imagine that on one hand, the Freudian psychosexual theory says that every child is born with a mental apparatus that is the main motivation for which, or the energy for which is to avoid pain and to seek pleasure, right? The pleasure principle and avoidance of pain. That is the main motivator. And then it goes on saying that after a certain age, especially in the phallic phase, remember, that a child has this unconscious wish to possess his mother and to eliminate his father. Okay, and in order to possess his mother, he has to eliminate his father, and the main motivation for which is sexual jealousy. And as soon as he realizes actually that, all his temper tantrums, anger outbursts gets retaliated by the father, who is the power figure. So he develops this castration anxiety, and then spirigo develops towards the end of phallic phase, and then identifies with the self, with the same gender parent. And on the other hand, remember the hadith saying that every child is born upon a fitrah, a natural constitution, an innate disposition towards development of tawheed, Allah subhanahu wa ta'ala's oneness. Sorry, okay, I just said this. Okay, so that is, we really, that needs to be revisited, and you can't build a master's degree or a PhD degree in Islamic psychology based on the current contemporary understanding of psychology. So the work really should start revisiting these developmental theories, as I said, and it's not. Remember John Locke's the British philosopher, that each child is born with a completely blank mind, and that everything is given and by the environment. Well, but that's not the case, really. The human mind is not tabula rasa. So actually I thought whether we could develop a curriculum, at least to start with, blending the Islamic principles of psychology with the current understanding of modern developmental psychology. So I drafted one actually, but it's very basic. So I'll just go through that. It will be my slides, and you can read afterwards. But I would like to focus a bit on this attachment theory. So the attachment theory is postulated by Bowlby and Mary Ainsworth. So basically, remember, it says that there is an attachment figure that is a parental figure who is sensitive to the child's needs and who provides the care and the safety in times of distress. So the attachment figure functions as a source for safe haven and secure base. That means when there is external threat, there is a shelter for the child to seek safety, and knowing that you have this safe, safe haven, then you can start exploring. So then that means that first you develop trust in others, that they will meet your needs, and then based on that, you can only develop trust in yourself. So basically, the question actually has been whether this really attachment theory can be applied to the people's relationship with God. It has been studied a lot, especially by Lee Kirkpatrick, and he's written extensively about it and written a book about it, that really the child's relationship with the parent as attachment relationship is similar to a pure adult's relationship with God. That God is the ultimate attachment figure who is always there and is a source of trust And actually, it has been studied in qualitative and quantitative research, and there has been lots of actually papers come out of it, but it hasn't been studied from Islamic perspective in some ways. Actually, there are lots of things that's missing. For example, especially whether the attachment of, as I said, the attachment of a child with the parent corresponds to that of parents with Allah subhanahu wa ta'ala. Whether when we talk about attachment to Allah, whether are we really talking about talking with the concepts of attachment theory, with the key words of attachment theory. So, okay, so first of all, as we know, so is that attachment relationship is top-down and bottom-up. So there is an attachment figure who provides safety and care and love and is a source of trust, and then the bottom up, that there's a child who is in need. So Asma al-Husna would be a good really source here. That's 99 beautiful names of Allah, the divine attributes. Al-Mu'min, Al-Mujib, Al-Razaq, Al-Hafiz, Al-Samad, and all others. Actually, the list is long. That the literature says that, well, these are the qualities of an attachment figure. So Allah subhanahu wa ta'ala, omnipotent and omnipresent. Wherever you turn your face, He is there. So He is an attachment, ultimate attachment figure, and that can be studied, hasn't been studied. So I can't actually see it there, but here my proposal would be, well, maybe actually future research would be on that, a child-centered approach to the implication practice of Islamic psychology as well. As we know, when we ask parents to do something for themselves, they don't do it all the time. But for the sake of these children, they do it. They are more likely to do it really. The development, the mental health of their child can be a more strong motivator for them to do things for themselves. So whether actually the parents, the family model altogether, and the relationship between father and mother as husband and wife, whether this could facilitate for child to develop an understanding that Allah Ta'ala is the ultimate attachment figure from very early age. Whether this a family model, a child-centered family model of this roles and responsibilities based on Islamic principles, and as I said, from very early age, Allah is the ultimate attachment figure, and the whole family dynamics are there to facilitate that. I think my time is up, is it? 50, okay. So there has been a lot really written about attachment and religion, and it's almost all from the powerful sources from the Christian's understanding and relationship with God. So this is an area of research. Attachment. So I benefit a lot actually from this paper, as you can see, Dr. by Bonap, Miner, and Proctor. So this is an area that we need to really think and write about. Thank you.
So for your one concrete advice for developing an Islamic psychology curriculum, what advice do you have in terms of developmental theory curriculum? Any advice? Advice for a new program in Islamic psychology?
Well, as I said, really, it's that model, that a child-centered approach is all based about adults' relationship with Deen, with Allah Subhanahu wa Taala, but putting a child in the center from very early age, and developing a curriculum actually around the needs of of the child. Mainly, I think that would be my approach.
Jazakallah khair. We have time for one question. So, here's my parameters. Raise your hand if you have not asked a question. Raise 2 hands if the question applies to everybody. You, the winner.
Thank you. I'm really interested in God attachment theory. Kirkpatrick in 1992 posited that a concrete anthropomorphic representation of God is needed to restore the feelings of security. Please refer Kirkpatrick 1992. He stated that a concrete anthropomorphic representation of God is needed to restore the feelings of security. 2, God, a substitute of attachment figure, i.e. mother. Security and insecurity of parental attachment directly predicts God attachment. So this and Minor 2014 explained that the feeling of being abandoned by God is delusional, misconceptions of God under the influence of Satan. So these are some criticism given to Kirkpatrick on God attachment theory. I have no problem when you extend Bowlby attachment of parental to adult attachment. I have a little problem when we want to apply inch by inch, step by step, whatever proposed by the Western into Islamic psychology. We have to be very critical, shift what is not direct, in line with the Islamic principles, throw it away, shift it, take the baby, but don't throw together the bathwater. I would like you to comment on this posited by the Kirkpatrick 1992. I think these are 3-4 things that are not in line with the Islamic principle. You may want to address this. Thank you.
Jazakumullah khair. Thank you. It's a very good point.
Wait, is that a question for everybody though, or is it for? Okay, go ahead. Go ahead. Answer.
Okay, because the mention of attachment theory, so I talk about the issue. Well, if we assume that actually it is Bowlby or is Ainsworth or is Kirkpatrick who first thought and written about it, then yes. But a lot has been already written, already been said in the old, scriptures as well by Ghazali, for example. And we can actually see references, to this. So in that sense, actually, as I said, I don't think we are here just trying to explain to take a model based on Christianity and apply it to the Islamic model just one by one. I don't think we are doing that really. It's just much more than that. But as I said, that we haven't written much about attachment theory from Islamic perspective. I'm not saying attachment theory, actually the concept of attachment from Islamic perspective. Okay, maybe this is what we need to put into center, not to revisit the Bowlby's and Ainsworth's theories. Okay, but just to write and to think about this attachment from the Islamic psychology viewpoint.
Anybody else who would like to answer that question? Or all right. Then I would like us to thank the panel. Thank you so much to Professor Dr. Rasool, Dr. Khalili, Dr. Rotman, Dr. Gurmez, and thank you, Dr. Hamada, for moderating in such an excellent way and for recommending us to work together and collaborate. So that's a good thing that we should do. All right, brothers and sisters, before you go, we will have a short break. It's very short, 15 minutes. I'm from Sweden, so 15 IKEA meetings. If you go to IKEA, everything is in place all the time, and Swedish people tend to be very almost like too much in time. But just for us to be able to be in time to benefit from the last panel, we'll keep it to 15 minutes. I don't know, like I'm from Iran. Iranian minutes are always like, if we say 1 Persian minute, it's like 10 Swedish minutes. So in the sense, try to bring that Swedish minutes. I don't know the Qatari minutes, how they are, by the way. You guys need to teach me here. Nevertheless, We'll see each other in 15 minutes. Take some refreshments outside. And while you are doing that, get to know each other. And we'll be here in 50 minutes. Jazakallah khair. Hope you had a great break with a lot of suhbah and blessed interactions by the grace of Allah subhanahu wa ta'ala. We pray that Allah subhanahu wa ta'ala will accept all the good deeds that you all are doing and all of our efforts to shift paradigms, both internally and externally. All right, we're coming to the end of this symposium, unfortunately. Are you guys glad or sad? Sad. I don't hear, are you guys glad or sad? Say sad. But don't be worried. We will have more symposiums. As Dr. Rajab Shenturk said, this is something that will be annual, inshallah. Dr. Human didn't know it yesterday, by the way, when Dr. Shenturk said that it will be an annual symposium. But alhamdulillah, that's a blessing, right? So hopefully we will be able to meet here every year, inshallah. It's beautiful to be here at Hamad Bin Khalifa University and College of Islamic Studies. And of course, we will meet in other countries as well, because the Islamic psychology movement is an international movement. So there's things happening all over the world all the time. Some gems that we can take from the previous panel was, for instance, what Professor Rasul said, to learn to swim before you jump into the water, which is something very important. So we appreciate, and that's something I will quote to you, Professor Rasul, mashallah. Also, to engage with your heart and engage with the qalb. And also, one reflection I think came from Dr. Rothman with regards to the importance that a therapist also works and cleanses his or her intentions and hearts as well, which is important. Dr. Wahdat spoke about tabula rasa, which also allowed me to think about how beautiful the Islamic psychological paradigm is, that we believe in fitra, right? We believe in our natural disposition towards purity and towards tawheed, and we're not born with a sin. So imagine how helpful that is when you're sitting with a client or you're speaking about this, that you can always reconnect to something pure that is innate in all of us, you know? And this is quite contrary to many other beliefs. So these are some of the things that I took with me from the previous panel, and I want to thank all the panelists for their amazing contributions. All right, we're going to go to the final panel for today, and after that we will have some closing remarks, so please stay tuned and be here until the whole part of this symposium is over, and then of course we're going to have the roundtable discussions after the lunch. This panel has the overarching theme of clinical supervision and career development. The first presentation will be about career prospects in Islamic psychology, opportunities, challenges, and future directions with Dr. Fahad Khan, one of our great colleagues and scholars. Presentation 2 will be about establishing standards and core competencies for clinical supervisions of trainees in applied Islamic psychology and counseling with Dr. Omar Mendoza Mahmoud, which is one of the great scholars as well. And the final presentation is about clinical supervision in Islamic psychology, philosophies, competencies, and goals, with a suggested model with Dr. Yusuf Musallam, one of the great scholars as well and a great friend of mine. And Dr. Musallam will speak in Arabic, so if you guys need to have translation, please take your headsets if you don't understand or speak Arabic fluently. And the moderator will be Dr. Wahdat Görmez from Turkey, who also was a panelist in the former panel and mashallah did an excellent job. So without any further ado, please, round of applause. The floor is yours, Dr. Wahdat.
Okay, Jazakumullah khair. I would follow the approach of Dr. Hamid Hamada. So all the information about bios and is in the book actually here. So our first speaker would be Dr. Fahad Khan. I believe you will stay in your chair there. Okay, so Dr. Khan is a licensed clinical psychologist with a doctorate in clinical psychology and a master's degree in biomedical sciences. And he's a fellow of the International Association of Islamic Psychology. But what's interesting is for me actually, is that mashallah, he's done great work with APA, American Psychological Association, and he's had very, really good awards. The early career champion and early career achievements awards.
Jazakallah khair. Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa man wala. تعز من تشاء وتذل من تشاء رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Okay, so inshallah I'm going to breeze through for the first few slides because a lot of it is repetitive. I think we all understand there's a demand for psychologists. I don't know if that's something good or bad. Like mentally we're all suffering more and more. You know, the world is going down the drain. So I guess as psychologists, we always have a job for us. But unfortunately, the downside is that it's not a very well-paid job in most, even in the U.S. So, I guess we're going down with the world. There's generally two types of careers in psychology. You have practice-oriented, like clinical, counseling, school, forensic, health, or sport. And then you have research and applied research, like cognitive and neuropsychology, industrial organizational, experimental, quantitative, social, and developmental. In the paper I go more in detail, but psychologists pretty much work everywhere. I think there's more appreciation, especially after COVID-19, for the work that we do, and especially mitigating stress and anxieties in that realm. So as I said before, if you want, I once made a joke. I teach a class, and in the introductions I ask, like, what do you want to do? And someone says, I want to be a psychologist. I'm like, oh, you're not going to make as much money. And one student reported me to the department, that she got offended that I made a joke like that. And I said, well, it's true. You're not going to make as much money. You get a 2-year degree in computer science, and you can make in the US a 6-figure salary. And postdoc psychologists in Chicagoland area, you still see advertisement of salary of $40,000. $40,000 is like minimum wage, right? Working 40 hours a week. So if you want to make money, become an industrial organizational psychologist. But we're here, Muslims, Islamic psychology. Hopefully our goal is beyond just making money and hopefully changing lives of others. I won't go into this. We've already gone. You understand the history of Islamic psychology. I want to jump into Islamic psychology careers because this is probably the most important and most relevant for us. So as for Islamic, those individuals who are graduates of Islamic psychology degrees, and also important for graduate programs, the first area, which is probably the most common one, is psychotherapy and counseling. So generally you have psychologists working in outpatient settings, hospitals, and I'm talking about long-term care here, community mental health centers, academic counseling centers, and masajid, I put a question mark because it depends. For example, Khalil Center in the Bay Area, we have an office which opens to the back of the masjid, so it has privacy because some people don't feel comfortable being seen and that they're going to see a therapist. So it depends on how it's done. There are established trainings that exist. So how to integrate Islamic psychology into practice is something that is now, alhamdulillah, we have established trainings that can help in a very systematic, in a very qualitative way to guide you, to guide all of us. I've listed some here. There are others around the world as well. This is not an all-inclusive list by any means. I am promoting our TIIP program. Inshallah, we'll be doing a level 1 training next year. The other area, which is more short-term, so this is where oftentimes in school psychology settings or health psychology settings, one of my rotations was doing heart and kidney transplant evaluations at a hospital where I also worked in traumatic brain injury. So if people who come in with some kind of trauma, they are seen for very short-term 2 or 3 session therapy. So it's a very solution-focused approach. But one thing we know through research is that when individuals have when they do face difficulties, immediate stress, whether it's academic-related stress or healthcare trauma, they often turn towards religion, towards God, towards spirituality. So it's a very important area for those who practice Islamic psychology to be a part of, and for the academic institutes to train them in. In fact, Zakat Foundation is building a hospital in Pakistan, and I was having a conversation with the president of Zakat Foundation, and one of the things that I had recommended was that, because he was saying we want to do something different. We want to do something that others around the world can take from the Muslim world. My recommendation was everyone who comes to a hospital should be seen by someone who is trained in psychotherapy, in some level of how to manage stress or help the family members manage stress, because that's very difficult, for family members, for individuals. And unless you go in for psychiatric reasons, you don't see a social worker or psychologist or a therapist in a hospital setting, either. So I think in terms of a quick solution-focused approach, these are good places for individuals to work in. Forensic psychology is a very in-depth topic. Dr. Human's dissertation was on forensic psychology, right? Did you publish it yet? You should really okay, you did. Okay, okay. So it's published. So you can ask him, where it's published. There's a books out there like Dr. Chalabi's book on forensic psychiatry. There's a rich tradition that exists that talks about how how psychology or forensic psychology and law intervene, and how there's a overlap between the two. In the West, sorry, Dr. Hamada. In the West, forensic psychology is unfortunately only present in the areas of like family and marriage issues. There's a divorce that's happening. Who's going to receive the custody evaluations, insanity pleas, or fitness to stand trials, right? So, was the person insane when they committed the crime, or do they even understand what the process is, the judicial process, court hearings, things like that, or what they're signing, for example. But as I said, this is an area which I think really, especially in Muslim countries, there's a lot of room for growth and opportunity for Muslim psychologists, Islamic psychologists to come in and contribute. And not only at the level of like court cases, but even in policy construction, policy making. I just found out earlier today that Dr. Omar Mahmoud, mashallah, helped write some of the laws that are in Qatar, right, related to practice of counseling. So having foundational knowledge in Islamic jurisprudence can be very helpful in aiding in that process, inshallah. And then industrial organizational psychology, right? So generally we think of, this is an area where like how human behavior is managed in the workplace, organizational systems, how to improve productivity, performance, etc. Now, given obviously we live in a capitalistic society in a world, this is oftentimes used just in sense of like how do we make more money, right? But from an Islamic perspective, I mean, there's much more to it, right? So Islam doesn't, when we make dua, رَبَّنَا آتِنَا فِي الدُّنْيَا حَسَنَةً وَفِي الْآخِرَةِ حَسَنَةً, we're seeking goodness in both dunya and akhirah. So, it is not mandatory for us to, so as a psychologist, go make more money. Like I'm asking you and recommending it, right? So this is not to say that just because the field doesn't pay well, that you should accept that. Inshallah, there's nothing wrong with that as long as it's halal and you're giving your sadaqah and zakat. Khalil Center is a non-profit 501c3, so feel free to donate anytime. In these organizations, or even talking about careers, what does a career mean for the individual? If I'm working as a computer scientist, for example, what will my app, the app that I'm working on, what will it do? What are some moral, ethical issues related to that? One of the things from the Ottoman times that I found fascinating was the idea of having futuwa nama, where you had certain code of conducts that are embedded into every single profession, right? Who is well suited to write them or define these codes of ethics or morality than someone who knows both the Islamic tradition and psychology, right? Working obviously alongside with those who are in the profession. So I think that's a very important area that we can contribute towards and really help and also facilitate the idea that when you put in the effort, it's for the sake of Allah. And as I was, I had a phone call from one of my family relatives who's struggling with finding a job, and he said, I have a job offer, but it's from an app that matches people for dating. What should I do, right? Like there's a lot of dilemmas that people have in that, and this is where I think Muslim and Islamic psychologists can also contribute and help. I have 5 minutes. Okay, now this is an area, theoretical, is something that I have been a big proponent of, especially recently. And I say that because if we look at the data and the state of mental health in the West, where it developed mostly, it's in a very bad shape, right? Every 11 minutes there's one suicide in the US, right? So, as I was speaking here, one person took their life from suicide. The second leading cause of death between 10 and 34 ages in certain groups. So mental health is failing in a system that was developed on a very poor, weak foundations, right? We claim as Muslim Islamic psychologists that we have strong foundations, we do. So we have to really develop the field theoretically. We have to really go back to the roots of it and even recognize. For example, Dr. Wahdat had the list of developmental psychologists, right? Vygotsky is an amazing psychologist. I love Vygotsky's work, but why don't we talk about that in him in the West? Because he was Russian, I think, and because he wasn't communist, I think they didn't even like him in Russia. So, political factors, power, money plays a big role in what theories come up and what theories are accepted. So the field is built upon this big machinery that exists in the back, right? In Pakistan, we call it the establishment, right? The establishment is driving what field or what is going to be studied, what is going to be published, what is going to be researched, funded, all of that. And so we as Islamic psychologists, we need to recognize that and then work on that theoretical reconstruction, as Allama Iqbal would call it, right? He reconstructed not only religious thought, but also scientific thought. And that's something that, again, we are well suited to do it because we have the basic foundations. And we have a history of scholars who did that. So here are my recommendations for education and training programs. And I have 3 minutes and 25 seconds. So number one, students must have strong foundational knowledge of the field and flexibility in its application. We cannot graduate individuals who went on ChatGPT and wrote up their assignment and submitted it. Okay, there has to be ways that we safeguard that. We have to have that gatekeeping done. On top of that, the tarbiyah model that Dr. Abdul Rahman presented, the idea that how do we have individuals who are working on ourselves, where those individuals who even have basic characteristics of what it means to be a therapist, how to listen to someone, be kindness, right, akhlaq. Those things, that's the institution's job. That's the job of training institutes and educational institutes. And that's going to then lead towards individuals who are knowledgeable, who know the field, and secondly, they internalize Islamic ethics and spirituality. It isn't just something we talk about, but we internalize it ourselves. And then also enhancing the skills in research methodology, data science, and statistics. I mean, the world runs on data, right? If you want to make a point, you have to be able to show data for it. So it is the job of academic institutes to be mindful of that, right? Like, for example, if someone comes and makes a claim, like 90% of the people do this, we have to ask, right? What's your source, right? Where did you, Sammu lana rijalakum, right? Where did you get this from? You can't just make a claim. So, and then if the data is being published, is it actually accurate data? If you're a reviewer for a journal, are you checking that all this contributes to then what is being practiced out there in the career, in the field? So we have to be mindful of that, and we have to have the skills to enhance that. And also, as part of that, I love machine learning and AI. I think psychologists, especially Islamic psychologists, can play a big role in the ethical aspects as well as the practical aspects of that. Foster a culture of supervision, consultation, and mentorship. Right. This is something Dr. Abdul Rahman and others have talked about within the educational institute. At Khalil Center, one of the things that we did, we have a hierarchy of supervision. Every individual has a supervisor, whether it's required by law or not. And then all the supervisors have a supervisor, which is Dr. Hamad. And Dr. Hamad, hopefully, is being supervised by Maulana Bilal. I'm going to make sure that he goes to those supervision sessions. But I know he sees Dr. Rajab. So the academic institutes should have that, right? Professors should have mentorship, supervision, collaboration, because that, again, goes back to when you're out in the field, that I don't feel like I know everything. I can go back and I can talk to my colleagues. I have someone that I can go back to, for guidance. And last, recognize the need for theoretical. I talked about this before, and I'll end with. If you're surprised, you shouldn't be. A line from Allama Iqbal, right? One of the things that he says is. Beautiful line of poetry. For Urdu speakers, you're going to love this, right? He says, Khudai lam yazil ka daste qudrat tu zuban tu hai. He's talking to the believer. He says, you are the hand and the tongue of Allah that is the ever-existent. And then he says, Yaqeen paida kare ghafil ke maghloob guma tu hai. Bring that certainty within you. That's how much power you have. And unfortunately, you're bogged down by doubts. Shaitan is putting doubts, I don't think I'm capable, I don't think I can do this. No, you are capable because your hand, we know the Hadith Qudsi, right? The hand of Allah. You see through, ittaqu firasatul mu'min, right? فَإِنَّهُ يَنْظُرُ بِنُورِ اللَّهِ. He sees through the nur of Allah. So if we claim to be Islamic psychologists, we have our Islam down, we have our psychology down. We don't hold ourselves back. We cannot hold ourselves back. We have to bring that certainty within ourselves, inshallah, with humbleness and humility. Jazakumullah khair for your time.
Jazakumullah khair, Dr. Khan, for this beautiful talk. So our next speaker is Dr. Omar Mendoza Mahmoud. Coming in, Dr. Mahmoud is currently a neuropsychologist at Executive Mental Health in LA. Previously, he was the acting clinical director of psychology in a clinical neuropsychologist at Sidra Medicine. That is the largest women's and children's hospital in Qatar, as we know. So I'll give it to you, Dr. Mahmoud.
Okay, Bismillah. Alhamdulillah Rabbil Alameen. Allahumma salli ala Sayyidina Muhammad wa ala Sayyidina Muhammad. نويت التعلم والتعليم والنفع والانتفاع. I will reflect a little bit, and I know it'll take a little from my time, but now that we're at the end of this 2-day symposium, there's a lot of things to process and debrief a little bit, and it even affect how I was going to think about my talk based on these amazing input and just presentations from these other scholars and experts and people that I was very just honored to be a part of in this gathering. I think there was a really poignant moment yesterday when Dr. Aid had a very emotional kind of response about his correspondence with Dr. Malik, years ago, and now the flowering of this situation is happening. It's blossoming now, and for many of us in this room, this is an ongoing thing, and every year it gets more and more just amazing. And الدنيا فيها عجائب. This is something to reflect, and the fact that we're including people, voices, and places that maybe weren't before is another a beautiful thing. And there's people and that I've learned and discovered in the last 2 days that I'm so thankful for. So the gratitude is something to reflect as well. And anyways, I don't have much to say, in the face of such scholarship and expertise in this room. But I'm sort of modeling what I would do with a clinical supervisee anything, which is to reflect and figure out how to assess where we are so far in our progress. Mashallah, this is a blessing to be here. And talking about clinical supervision and trying to find an advisor, from the Quran, Musa alayhi salam, he sees that there's Khidr, and he asks, "Can I follow you, so you may teach me from some of the right guidance you have been taught?" And Sayyidina Khidr, he responds, قال إنك لن تستطيع معي صبرا وكيف تصبر على ما لم تحط به خبرا. I don't know if you'll keep up. And it's true, you can't be patient on something that you've never experienced yourself. Now that you've experienced it once, then the next time around you will have that capacity to have patience because you remember something about it before. And I reflect that during clinical supervision, when I look, past, thinking about my advisors, my mentors, my supervisors in the past, there are times when they'll ask you to do things that seem counterintuitive, and you have to trust the supervisor. And some of it doesn't, feel what you're used to. It's not familiar. And sometimes the role of the supervisor is to kind of guide you through these sort of muddy, sort of unclear waters. So I think, I always reflect on that relationship between Musa and Khidr in that realm. Just a joke to kind of introduce some of these concepts, but there's a doctor. The doctor says, the patient says to the doctor, "I feel as though nobody understands me," and the response is, "What do you mean by that?" And so sometimes the clinician becomes the problem too, and it contributes to the person's, psychopathology, and it doesn't help with the stress relief and these kind of things. I think we always have these jokes in mental health, and I'm sure I heard them in grad school, and I'm sure Dr. Rania, you heard this in med school. But anybody who a student goes into a mental health providing a profession, usually there's this idea of what attracts them to the topic of psychology and mental health. Is it your own, struggles and things? And there's always these jokes about how you'll find a lot of psychopathology in actual mental health practitioners, all around. And it's something we have to kind of admit, at least, even though we joke about it. We're all human. We have nufus, and the nufus has its own goals. It's not the lofty goals that you would like to follow in your life and get closer to Allah and follow the sunnah and the example of our beloved Prophet Muhammad sallallahu alaihi wasallam. The outline of what I'll just briefly talk with you all today is here, and it's obviously this is just sort of a highlight of what I'm writing. More is about just a little bit of a framework about the competencies. What happened when I first came here in Qatar 6-7 years ago, there was no licensure requirements. It was very limited. You could have a bachelor's degree and call yourself a psychologist and practice as well, and there was no consequence or oversight. And in the States, the term psychologist is it's a protected title. You can't just call yourself that. But here it was rampant. And so we went to the Ministry of Health here, and I presented them just some international standards about what are the best practices? How do you have mental health professionals? How do we make sure that they're qualified and appropriate, and their education matches what they say they're doing, and what are they licensed in some way, and so forth. So we help them to develop. Now there's you have to have a requirement of your education and your experience and so forth. It was a little bit of a struggle because sometimes in this region, the family would say, my son or my daughter has a bachelor's in psychologist. Can't they call themselves a psychologist? And they don't understand that this is just a foundational degree at first. You need further training and experience before you can call that. Although in other fields you can get a bachelor's in engineering and then call yourself an engineer. It's a paradigm that's changing. I don't need to talk much about this. I think there was amazing discussions yesterday about the ethics codes, and Dr. Khalid did a great job of just kind of the integration of that into what we would hope in Islamic psychology, and how our practitioners will use the ethical codes. Of course, taking from the Western codes of conduct, but as well, of course, the Islamic principles. When we're thinking about what are the competencies, what are the things that we want to make sure we have in our trainees, the first question is, who is ready to be trained? You know, it's not, you don't just wake up and be, you know, you're ready to start as a trainee. There's even some things that need to be required first before you can actually become the trainee. And part of that is just education. So we talk about, like, you know, we just mentioned there was, in most of the models we're discussing, you need more than just the foundational degree. You need then some advanced learning. And so the master's degree became like, okay, at least that's the level that we would, before you could start getting trained. And then the idea that you're done with your master's degree, but you still need 2 more years of supervised hours so that you could demonstrate that you learned, and that, you know, you, with the guide of a supervisor, that you're building up a repertoire and skill set that you can then eventually use when you are an independent clinician. So your education is part of it. Your personality is part of it. There are some cases of people where people don't fit, you know, and it's rare, but I still remember when I was in grad school, one of my cohort, after 2 years in our PhD program, they left, and I asked one of the faculty what happened. They said, well, we had multiple talks with this person, and he was good, he was genuine, but it just didn't work. In supervision, he couldn't alter himself in a way that would benefit the patients, and he was kind of rigid on certain things. And so there is that, and then there's the himma, the determination. Are you ready to be consistent? And then, you know, after training, what do we want to have in our students? What do we want to see them to be in their career and going forward? Supervisors, again, have their own competencies as well. Can every clinician qualify to be a supervisor? That's a good question. And some clinicians realize it later in their career. They're like, you know, that's not my thing. So when the practicum students come around every year and you get assigned a supervisor, some of the clinicians say, look, you know, I'll help you with some of the didactics, we'll do some talks, but I can't really take on a student. I've tried it in the past, and that's not my forte. Okay, that's some self-awareness, hopefully. Not every clinician is suitable to be a supervisor, but every supervisor must be a clinician, or at least have vast experience. You know, maybe they're not currently practicing, but they have some past years of just dealing with different kinds of patient populations. So you need to have that in order to say that I'm supervising these people and I'm talking about things, but have you seen patients in this, you know, sample, this type of patient population? You know, in the 6 years that I was here in Sidra, and the majority of our patients were Muslim, I had 5 or 6 cases of this gender identity issue. And so they're very rare cases, first of all. And then in a Muslim family, how do you negotiate that? How do you advise the trainee if they get assigned a patient in this situation? And so we have to be careful and be humble about our own scope of what we've experienced. You know, you can have talks and lectures about some topic, but you've never actually seen a patient in the flesh about this particular diagnosis or case. It's problematic. So the importance of continuing education, so continuing professional development. The supervisor needs to always be updated on what's going on professionally in the field. Continuing spiritual development as well. Like, if we are in this integrated model, then it's not just about your book knowledge as well, but it's also your spiritual progression as well. I still go back to the mashayikh that I learned from, and some of the advanced students of knowledge that I still ask for advice. Years later, because I need some kind of support system even if I'm the supervisor. And the importance of peer consultation, that especially as we're coming to this, we're in a stage now where this message has been kind of repeated at different times here in the last couple of days, but like we can't just be isolated. We need to like seek peer consultation with each other. Be humble. Understand that, you know, maybe I have things that I could improve on, and I could ask a colleague about it. And that could be someone who's younger than you, you know, even, and you could learn from. I learn a lot from the people that I supervise sometimes. I mean, they give me insights that I wouldn't have thought of. I'll skip over just because of time. The role of the supervisor. Basically, you're trying to foster an environment that nurtures the students' spiritual and professional growth.
You have actually 1 minute, Dr. Mahmoud.
Okay, thank you. So I will just skip through some of these things. I think one comment that you know, as an educator, you know, Sayyidina Anas, he says, خدمت رسول الله صلى الله عليه وسلم 10 سنين فما قال لي أف قط. I served with the Prophet ﷺ for all these years, and he didn't have these scolding statements, you know. And how do we transfer knowledge to our students without being this kind of like, you know, mean, pedantic person who's just always, lecturing you, but without giving you the dhawq, that there's a lot of non-verbal knowledge that takes place, as Dr. Rahman mentioned, that there's things under the surface. And if I'm supervising a clinic trainee, it's not just about the content, about what they're going to say, but also internally, what's their intention? What are the concepts spiritually that you, as a clinician, are imparting to the patient without any verbal things, just your presence, and as Dr. Hamad mentioned, even just the relationship between the therapist and the patient is enough. So I'll just I think it's the time, so I'm just gonna basically say a couple things that I just want to quickly highlight. Some dangers, making sure that we make sure that our trainees are doing proper documentation. That's a major issue, and how to write proper reports and documentation. And then what happens to a trainee who violates the ethical principles, and then they get blasted, you know? So every year, the Board of Psychology in California, for example, they will do يفضحون. Anybody who did something, you know, that was violation of ethics, they get published, you know, and their license gets taken away. And what I'm saying this is, what about, so if we have a student who came to one of our programs or who got one of our certificates and does this, what does it mean for our institutes? And so this is there are dangers in it as well that we need to just be aware of and consider.
Well, we'll have to finish it here. Jazakumullah khair, Dr. Omar Mahmoud, for sharing these beautiful ideas with us, and the metaphor of actually the journey of Musa and Khidr as a metaphor, analogy for supervision and supervising their journeys, really very, very good, very interesting. So the next speaker actually is Dr. Yusuf Musallam. Dr. Yusuf Musallam is going to talk about clinical supervision in Islamic psychology, philosophies, competencies, and goals with a suggested model. And his bio is in the book, but one thing I need to add in addition that is not in the book actually, he is a training manager for the Beck Institute CBT training program in Jordan, and that is one of his main areas of expertise. It's yours.
بسم الله والصلاة والسلام على رسول الله. سأتحدث بالعربية، لكن أرجو أن تستطيعوا اللحاق بما أتحدث به. لأجل ذلك أرجو أيضا من المترجم أن يكون سريعا في الترجمة قدر الإمكان. ما سأتحدث به بداية أنه اعتدت دائما أن أكون الأخير في الصف. بماذا؟ عندما يسلم الشهادات أو الأوراق، لأنه اسمي يوسف وحرف الياء هو الأخير سبحان الله، فاليوم أيضا أنا الأخير، لكن أسأل الله أن يكون ختامها مسك. فشكرا لكم جميعا وشكرا لمن دعوني لهذه الدعوة، وأسأل الله أن يشد بكم أزري فنكون بمرتبة موسى من هارون وهارون من موسى، فيشد أزرنا ببعضنا بعضا. فاللهم يسر لي أمري واشرح لي صدري. ما سأتحدث عنه اليوم هو جزء من تخصصي في مرحلة الدكتوراه، ولكني أريد أن أنبه إلى أمر. لقد درست البكالوريوس في نابلس فلسطين، وفي ذلك الوقت عند تخرجي تقريبا في السنة الأخيرة كانت أوقات انتفاضة الأقصى. في انتفاضة الأقصى كنا جميعا متطوعين في العمل النفسي. كنت في السنة الرابعة، كنا متطوعين ونقدم خدمة العمل النفسي، وأثناء تقديمنا لهذه الخدمة تم تدريبنا على منهج يسمى ديب بريفينج، وجاء به جون أبو عيون جريئة وزرقاء إلينا من البلاد الغربية وعلمنا عليه. لكن ما اكتشفناه بعد 3 سنوات من تقديم الخدمة ل1200 أسرة فلسطينية، وأجرينا دراسة أن هذا المنهج كان ضاراً ويؤدي إلى تفاقم الصدمة عند الناس وليس إلى تفاديها. فسبحان الله. ولأجل ذلك حتى من اليوم أنا لا أثق إلا بالتايمر الخاص بي. لم نعد نثق بأي منهج يأتينا من الخارج إذا لم نحسبه، ولأجل ذلك ترى الأدوات في غزة من صنع أهلها، فلم نعد نثق بأدوات أحد. هي أدواتنا التي نريد أن نعمل عليها. ومن هنا كان يجب عليك كأخصائي نفسي، نظرت في يوم من الأيام إلى حاجة أهلي للعلاج النفسي والمتابعة النفسية بأن أنظر بعمق إلى التخصص النفسي فأعرف ماذا نحتاج، ليس استيرادا وإنما تأصيلا وصناعة. وما قاله الزملاء من قبل في هذين اليومين نرى من خلاله أن أهل غزة لم يقرؤوه، لكن أثبتوا بالعزة الغزاوية أننا نستطيع أن نتعلم منهم اليوم. فهم دراسة حالة مهمة لنا نسجل من خلالها مناطق العزة والصمود، وندرس من خلالها صمود الإنسان، بحيث نسجل من خلالها علم نفس جديد. فما هو علم النفس الذي سنسجله؟ وما هو علم النفس الإسلامي؟ لأجل ذلك درست وخلال سنوات من دراستي CBT REBT EMDR، وكنت وصلت إلى درجة الإشراف بها. لماذا؟ لأن الاختصاص النفسي يختلف عن علم النفس. ما تحدثنا عنه غالبا كنا نتحدث عن علم النفس. علم النفس هو المظلة الكبيرة، لكن التطبيق الحقيقي هو العلاج النفسي. فهنالك فرق عميق جدا ما بين علم النفس والعلاج النفسي. فهل كنا نتحدث عن علم النفس أم عن علاج النفسي؟ إن كنا نتحدث عن تطبيق فسننتقل من الفلسفة النفسية إلى أن نفهم المدارس وبنية المدارس، وهذا ما كنت أدرس خلال 20 عام. كيف يكون العظم قبل اللحم؟ كيف نجعل العظم موجودا قبل أن نبني اللحم؟ لأن معظم من جاء بلحم الأمور لم يأتي بعظمها. ولأجل ذلك الدراسة العميقة للتخصصات النفسية والعلاج النفسي تجعلك تنظر من الداخل إلى حقيقة هذه التخصصات. فكل اختصاص نفسي يبدأ حقيقة بفلسفة حاكمة لهذا الاختصاص، ومن خلال الفلسفة الحاكمة نأتي فيما بعد إلى الافتراضات والنظريات التي نبني عليها التصورات التطبيقية العلاجية، ومن ثم التطبيقات العلاجية. فالتطبيق العلاجي لا يمكن أن يكون بلا فلسفة حاكمة. فلأجل ذلك أرى أن علم النفس الإسلامي أو ما أسميه مدرسة المفاهيم النفسية الإسلامية الهدف منها بداية تغيير الفلسفة الحاكمة إلى إطار حاكم حقيقي يجعلنا نبتعد عن الداروينية العميقة في مضمونها، والتي شكلت النظرية النفسية إلى الخلق والخالق الذي خلق الإنسان، ومن أعلم بالإنسان ممن خلقه. وهذا ما يجعلنا ننظر في أدبيات ابن القيم إلى المعالجين، فينظر ابن القيم أن محل النظر حقيقة في ما نفعل هو في مناحي كثيرة. لكن لنعود، علم النفس والعلاج النفسي، هنالك مدرسة نفسية، هنالك تطبيقات نفسية، وهنالك علاج نفسي. فهل يمكن للحظة من اللحظات إذا كنا نريد العلاج النفسي أن نفهم السمك بغير فهم الماء؟ أسئلة سأجيبها أنا. لا يمكن أن نفهم الإنسان بدون أن نفهم الحياة، وهذا المربع الناقص حقيقة كان في النظرية الغربية. النظرية الغربية نظرت بكلتا العينين إلى الحياة الدنيا، ولكن نحن ننظر بعين إلى الدنيا ومحطتنا هذه الدنيا، وبعين إلى الآخرة ومعادنا في الآخرة. وهذا بحقيقته يختلف عن كيف سننظر إلى وظيفة النفس، وكيف سننظر إلى نقلة هذا النفس أو هذه النفس من الدنيا إلى الآخرة. وهذا المنهج الأساسي الذي نعمل عليه، بحيث نفهم هذه الدوائر الثلاث ما بين الإنسان والرسالة والحياة في مركزة الخلق والخالق، مركزية مهمة تجعل المنظور إلى الإنسان مختلف. فما الذي يجعل النجار نجارا؟ لو كان عندي كل الخشب وكل أدوات النجارة، فهل أنا نجار؟ ما يجعل النجار نجارا حقيقة هي كفاءته. كلمة الكفاءة هي الكلمة الأساسية في كل اختصاص مهني. من ينتقل من علم النفس كمدرسة ومظلة ويكون باحثا فيها إلى التطبيق وهو العلاج النفسي يحتاج بعمق أن يفهم كلمة كفاءة. فكلمة كفاءة هي ما تجعل المعالج معالجا. فهل يمكن قيادة السيارة من مجرد قراءة كتاب؟ وهل يمكن السباحة من مجرد قراءة كتاب؟ طبعا لا يمكن. لأجل ذلك دراسة علم النفس فقط لا تكفي لنستطيع أن نخرج بالتطبيقات. التطبيقات تحتاج إلى أستاذ مدرب خبير في المجال حتى يستطيع أن ينقل المهني من النظرية إلى التطبيق. ولأجل ذلك عندما نعود إلى the bones اللي هو الهيكل العظمي الذي رسمناه قبل قليل، هذا أهم شيء أن يعرف عنه المشرف. السوبرفايزر يجب أن يكون فاهما لفلسفتي وتصوراتي والنظرية والتصورات المفاهيمية وأيضا التطبيقات وأشكالها. شيء من التاريخ وما يجب أن نتعلم من الأستاذ. بداية نرى في تاريخنا أن هنالك الملازمة كانت موجودة دائما للطلاب، فأنت تأخذ سندا في القرآن من أستاذك، تتبع الحديث من أستاذ، فدائما وجود الأستاذ كان مهم في تاريخنا الإسلامي لكل متعلم قبل أن يتصدر للتعليم. فهذا ليس بالجديد، وهذه ليست بالفكرة الجديدة أن يشرف عليك أستاذ فتنقل منه علمه وأدبه وأخلاقه وطريقته ومنهجه. بالتالي عندما نتحدث عن الكفاءات في الدراسات الأكاديمية للإشراف تحديدا، وهذا ما تخصصت فيه في مرحلة الدكتوراه، كانت رسالتي في الدكتوراه هي في نصفها في موضوع الإشراف والمناهج الإشرافية وفلسفة الإشراف. لأجل ذلك أول كفاءات نتحدث عنها هي الكفاءات المعرفية. ماذا يجب أن تعرف؟ وهذا ما تحضرنا له الأقسام الأكاديمية. القسم الأكاديمي يحضرك ماذا يجب أن تعرف. كثيرا ما نسمع عن دورة تدريبية، لكن عندما تذهب إلى الدورة التدريبية تكتشف أنها محاضرة، لأنه علمك ما تعرف، لم يعلمك الأداءات السكيلز. أما الأداءات والسكيلز فهذا مستوى آخر يحتاج كل ممارس مهني لأي مهنة. فهذه المهارات تتعلمها من خلال التدريب. هنا يأتي التريننج أو التدريب والدورات التدريبية. أضفت في منهج الإشراف نقطتين أساسيتين، لأنه ممكن أن تكون متعلم جيد، لديك المعرفة الجيدة ولديك الأداءات الجيدة، لكن لا تستطيع التطبيق في السياقات المختلفة. حتى تستطيع التطبيق يجب أن تعرف كيف تجمع النظرية مع التطبيق مع فهم السياق العام، وإلا لن تكون معالجا بارعا. لكن حتى لو كانت هذه الثلاث عندك بلا أن يكون عندك حس وأحكام، هذا الكلينيكال جادجمنت، بلا أن ينمو عندك الحس والأحكام السريرية بشكل سليم، ستبقى ممارستك للعلاج ناقصة. هذه الرباعية الأساسية التي نعلم عليها الطلاب، بحيث يتم من خلال معرفته نقله إلى أداءات، ثم إلى تطبيقات، ثم إلى حس وأحكام سريرية حقيقية، حتى يستطيع أن يعرف ما هي الأولويات التي تقدم للإنسان الذي يجلس بمقابله. وبالتالي دور المشرف يأتي بأربع تاءات أساسية. الأولى التقييم، فيجب أن يعرف كيف يقيم أداءات المعالج. إذا لم يكن المشرف قادر على تقييم أداء المعالج فهو ليس مشرفا، إذن هو لا يعرف المدرسة التي يعمل على أساسها وعلى منهجها. بعد التقييم أن يستطيع التدعيم، لأن المعالج أيضا إنسان، فأنا كمشرف يجب أن أوفر التدعيم هذا المعالج الذي يدرس معي وعندي وتحت يدي. وجزء من التدعيم في علم النفس الإسلامي يتعلق حتى في التدعيم الروحاني، لأني حريص على ديانته فيما يقدم. فهل صحيح عندما يأتيني شخص مدمن على الخمر أن أقول كما في المنهج الغربي لا بأس من شرب قليل من الخمر، لكن المشكلة في الإدمان؟ هذه قضايا أساسية ومنهجية نحتاج أن نبحثها بعمق ونفهم كيف ندعم المعالج عندما نتعامل معه بطريقة أو بأخرى. ثم يأتي دور التعليم، وهو التعليم العادي للجوانب المعرفية والمهارية، ثم التدريب، وهذا التدريب يكون على الأداءات وأيضا على التطبيقات والأحكام السريرية، بحيث نستطيع أن نعد معالج لا يسبب أذى لأحد. No harm، هذه القاعدة الأولى في تقديم الخدمات النفسية. فالمعالج يقدم الخدمة، والمشرف هو حارس بوابة هذه الخدمة، حارس الاسم. من سيخرج ويقول أنا معالج في علم النفس الإسلامي؟ هنا يأتي السؤال: كيف نحرس هذا الاسم؟ كيف نحمي هذا الاسم؟ كيف نحمي هذه البوابة؟ هذا دورنا. لكن ليست فقط بوابة العمل المهني، كيف نحمي أيضا النظرية التي نعمل عليها من يستطيع أن يمس بها بطريقة أو بأخرى بحجة البحث العلمي، فيمس بكتابنا وسنتنا من باب أنه يبحث في النظرية وفي تطبيقاتها. يجب أن نحذر من ذلك. هنا يأتي المشرف عليه، من سيتم الإشراف عليه، the supervising. فهنا نتحدث عن 3 مراحل، اللي هي المصدر والمقصد والمسلك. هنالك مصدر للتلقي، وهنالك مقصد مما تتلقى، وهنالك مسلك كيف تسير في ذلك. وهذه هي مقاصد الشريعة، ومقاصد الشريعة هي مقاصد كل علم رباني أو من قبس رباني حقيقة. ففي المشرف عليه المصدر هي المعرفة النفسانية، والمقصد أن يخرج بالتطبيق، والمسلك أن يقدم الإرشاد والعلاج. تمام؟ وهذه المنظور للعلاج. هدف العلاج الحقيقي هو حفظ القوة حسب ابن القيم، أو الحمية عن المؤذي، أو التخلص من آثار الأذى والتدخلات. هذا في كتاب الروح عندما ساق ما هي فعليا أهداف معالج القلوب أو طبيب القلوب. في المقابل لما نتحدث عن المشرف عليه وكيف يعمل على نظرية معينة، المشرف يجب أن يكون فاهما لهذه النظرية ويعكس بشكل أو بآخر دور في هذه النظرية. فالمشرف يجب أن يكون المصدر المعرفة والتطبيقات. الآن زدنا التطبيقات. المقصد نقل الممارسة، هذا مقصد المشرف، نقل الممارسة. والمسلك في التطبيق التقييم والتدعيم والتعليم والتدريب للمشرف عليه. وبالتالي دقيقة ونصف. وبالتالي دور الإشراف حفظ مصادر القوة الموجودة عند المعالج بحيث ننميها، والحمية عن مصادر المؤذي في الممارسة العلاجية فنعلمه كيف do and don't، وأيضا التخلص من آثار الأذى والتدخلات برعايته، فيقدم التقييم والتدعيم والتعليم والتدريب على ما يرضاه الله عز وجل. بالتالي هذا النموذج التطبيقي الكبير، هذا نموذج تطبيقي نستخدمه في مدرسة الأمل النفسية وفيه كثير من الأمور. لكن حتى يكون هنالك عمل يجب أن يسبق في العملية النفسانية الإرادات، والإرادات هذه يسبقها الغايات والأهداف الغائية. وهذا النموذج الكبير الذي يشمل الإشراف. فالهدف من الإشراف، كل مدرسة علاجية هي على 5 محاور مهما كانت المدرسة العلاجية. أي مدرسة علاجية سنجد المحور الأول مفاهيم وتصورات علمية للمدرسة، ثم سنجد في المدرسة القياس والتحليل للسلوك بطريقة هذه المدرسة، ثم سنجد التدخلات والأدوات للمدرسة، ثم سنجد المفاهيم والعناية والتواصل مع نفس الناس في هذه المدرسة، ثم الأثر وقياس هذا الأثر العلاجي معناه، وكيف نعمل وقاية من الانتكاس. هذه الخماسية هي العظم لأي مدرسة، هي الهيكل العظمي لأي مدرسة نفسانية يجب أن ترتب عليه. لكن هنا تأتي الكفاءات، فهي معرفية، أدائية، تطبيقية، وأحكام، مقابل الأدوار التي سيلعبها المشرف من تقييم وتدعيم وتعلم وتدريب. بارك الله فيكم لاستماعكم، ونسأل الله أن نلقاكم في أيام أخرى بخير من هذه الأيام، وفلسطين محررة كاملة.
Jazakumullah khair. Dr. Yusuf Musallam. So if you take your seats, have you got time for questions? And just one question. Yeah. Okay, just one question over there, please. Yeah. Okay, but we don't have time for that, do we? Yes, please. Do you have a microphone? Yeah.
Debriefing, and especially when you mention Gaza and the situation in war zones. I fully agree with you. دكتور يوسف يا دكتور يوسف أنا بشكرك على المداخلة اللي أنت حكيتها بالنسبة للدي بريفينج، وكيف لما بيجينا أبو عينين زرقاء يتدخل في ما يعرف بالاضطرابات النفسية اللي بتكون عندنا بعد الحروب. وهو واضح احنا لو دققنا فيها كويس ربما ما يكونش فيها نوع من الاضطرابات، لأنه بنحكي احنا عن ريزيلينس. لما تطلع على أطفال غزة والطفل اللي قاعد بواجه الدبابة وبعد احنا نروح نعمل عليه diagnosis انه عنده PTSD، هذا موضوع احنا we have to think about it، لأنه ما يبنى على diagnosis يبنى عليه interventions. فأنا I fully agree with you إنه debriefing لازم ناس يكونوا جايين من الكلتشر نفسهم ومن الثقافة نفسها. هذه أنا أجري معك. لكن إحنا لما بدنا نطلع هذه كومنتس، أنا حابب صحيح كنت من امبارح بدي أحكي فيها 3 شغلات إحنا نطلع عليها. طرحوها الإخوة لما إحنا بنطلع على الCBT، بنطلع على أي يعني تدخلات نفسية therapeutic modalities كلياتها مصممة في الغرب. وهذه الموداليتيز سواء كان الCBT سايكودايناميك ولا اللي بدك اياه سميه، كلياتها هذه مصممة في الغرب بما يتناسب مع الثقافة تبعتهم، بما يتناسب مع العادات وربما مع الدين. لكن احنا لما نطلع عليها نديب، وهذا ماي مسج انه احنا لما نيجي نحكي على الاسلاميك ثيرابي الابلكيشن تبعتها، هذه مجتمعات اللي انبنت فيها هذه الموداليتيز مبنية على individualistic approach، يعني انه الشخص هو الاساس. احنا collectivistic approach، وهذا اللي بدعمه الاسلام، لانه احنا في الاسلام بنقول امة، بنقولش فرد. احنا بنقول اسرة، بنقولش فرد. حتى في الهيلب سيكينج بيهيفير، لما احنا مثلا واحد بده او واحدة بدها تروح على حتى لو بدها تعمل سيرجري she has to take a decision، مش لانه demoralization، no it's part of the collective issues. فاحنا لو بدنا نحكي على therapeutic Islamic therapy it has to be متماشي مع هذه الفلسفة. المسلم أخو المسلم. ماذا يعني الأخ إنه بشعر فيه وكمل الحديث. أوكي؟ وإحنا كالبنيان المرصوص مش individualistic approach. كل الموداليتيز هذه مبنية على individualistic approach. فأنا اللي بتمناه، وهذه رسالة للأخ خالد وللمنظمين، إنه لما إحنا نحكي على applications يعني مش ثيوري، تكون مبنية على هذه الأسس. لأنه إحنا بنطلع كمان إنه هذه الدايجنوسيس أولاً pathologizing، تعمل pathologies، medicalizing our sufferings. إحنا لما عملنا البحث في
sorry we have to finish.
في غزة إحنا عملنا البحث، لقينا إنه الناس بتشكي. لما إحنا كنا بنحكي عن التروما، الناس المعنى تبعت التروما is loose، لكن نحكي كأنها كانت تحكي على مصيبة، وكانت تحكي عن inflation of pain، فاجعة. شايف؟ فهذه أمور إحنا في البحث بدنا نطلع عليها. هذه ما يكون من. شكرا لك.
Okay, thank you. Yeah, if you want to say just for
الشيء الوحيد اللي بدي أعلق عليه على كلامك إذا سمحت لي، بما إنه سؤال اللي فهمته إنه حضرتك تتحدث عن موضوع طبيعة غزة. هو فقط تنبيه، أنا يعني سبق وقلت للزملاء عندما يقدموا الخدمات النفسية في الدعم النفسي لأهل غزة يجب أن يتنبهوا، لأنه إحنا بنحكي عن بنية نفسية مختلفة حقيقة، تمام؟ لأنه أنت ممكن تستهدف عناصر الصمود. باختصار السايكولوجي بمناهجه الموجودة واللي درسوها الناس في كلتا العينين تنظر إلى تمكين الذات، لكن علم النفس الإسلامي ينظر في عين إلى تمكين الذات وينظر في عين إلى الآخرة. وبالتالي ماذا لو كان هذا المبتلى بالفقدان والحزن والحزن وغيره إذا جاء عندي ضيعت عليه فرصة الاستعانة بالله فاستعان بنفسه فضاع الهدف من الابتلاء في حياته. هدف الابتلاء نعم لن ينفي ذلك، بس أكمل. لا ينفي ذلك. اللي بحكيه إنه عادة الفرق إنه إحنا تبقى هنالك عين إنه في آخرة موجودة في حياة الناس. هلا هذا لا يمنع الدراسات ولا يمنع إنه إحنا بنعرف إنه في اضطرابات نفسية وهذه الاضطرابات تؤثر على النفس. نحن لا ننكر العلم الموجود، ليس هدف الإنكار، لكن أيضا نعلم إنه جزء من فقه الابتلاء وجود المرض والاضطراب هو فرصة للتقرب من الله عز وجل والعودة إليه. فلا يكون الركون والاستعانة في النفس فقط، لكن نوجه مركزية الاستعانة من الذات إلى الاستعانة بالرحمن ورب الذات.
Okay, thank you very much. This is the end of our panel, and I'll leave it to you. Thank you.
Jazakallah khairan. I want us to give a round of applause to Dr. Fahad, Dr. Omar, Dr. Yusuf, and Dr. Wahda for this great panel and an important discussion that we will continue, inshallah. Thank you so much for all of you. We still have a couple of points left in the program. I see a lot of you are waiting for the lunch. Alhamdulillah, it's soon here. First and foremost, without any doubt, there are some great quotes that we can bring with us. Dr. Omar, for instance, you mentioned not all clinician can be a supervisor, but every supervisor must be a clinician. And this is really a good reminder, actually, that to be a supervisor, you need to have the experience of being on the opposite side as a supervisee or as a clinician. Also, another thing that I was thinking about is related to Dr. Fahad, when you were speaking from the Urdu perspective. I was thinking about peer consultation. And peer in Urdu and Farsi means old. So you can use peer consultation to consult your peer, but also peer consultation to consult with a wise one, which is also the definition of peer. So maybe we can also add that connection to the word peer. Nevertheless, brothers and sisters and all participants, we're coming to the end of the symposium for this year. But before we finalize, we have a couple of more closing remarks speech, and then I will also summarize with some last remarks, inshallah. First and foremost, we want to welcome Dr. Hamad Kishavarzi up to the stage, which has been one of the organizers of this symposium, and he is also part of the Khalil Center, which is one of the core organizers, and he will be leading the Masters in Counseling Psychology program here at College of Islamic Studies, Hamad Bin Khalifa University. Welcome up to the stage, Dr. Hamad, for closing remarks. Rounds of applause.
بسم الله الرحمن الرحيم الحمد لله رب العالمين وأفضل الصلاة وأتم التسليم على سيدنا محمد وعلى آله وأصحابه وذريته ومن تبعهم بإحسان إلى يوم الدين. Assalamu alaikum wa rahmatullahi wa barakatuhu. Once again, this is coming to the conclusion of our symposium, and I say this with both gratitude and sadness upon its conclusion. Great gratitude and appreciation for everybody that has come out to be a part of this. I think individuals have noticed that this is a different kind of discourse that we're having here. The typical sort of discourses around psychology are just talking about the possibility and the idea of the incorporation of Islam and spiritual practices into mental health. And we are taking it a step further than that. We're going much beyond that. And we're talking about advancing its practice, standardizing its curriculum, dealing with ethical dilemmas and parameters and philosophies. We have models that are established, and I'm just so appreciative of everybody's contributions, and I look forward to what comes after this. This is only the beginning, right? Just like whenever we finish any book under a teacher, they typically say, this is just the beginning to the next one. And usually we'll start to read even a line from the next book just to ensure that there's a continuity, that the idea isn't that we're just done here. And so we hope that we will continue this conversation through various avenues. Dr. Rajab has already mentioned that we will be having this annually, inshallah, and we hope that what we've started here will be the beginning to much good and much networking and the proliferation of many programs in Islamic psychology that will continue to benefit from the wealth of knowledge that's contained in this room. Dr. Hamada had mentioned about the panel and over 100 years of experience contained within the panel and over 100 articles in published works and books just on a panel of 4 people. We had a total of how many? 6 panels, right? 6 entire panels. And if you take the accumulation of all of the scholars coming from various parts of the world and their years of teaching, years of clinical training and practice and publishing, we have, subhanAllah, a wealth of experience contained within this room. And so what we're going to do for our participants, just so you don't leave, our scholars in the room, we'll have a closed roundtable, inshallah, to be able to allow for some further discussions amongst us. So please do stick around after the lunch. I do appreciate all of your contributions and all of the participation, coming out here, being with us for 2 days, everybody on the virtual platform that's listening to us from different parts of the world. You're tuning in. This is an opportunity for us to give back to the world, right? We're reversing the flow of information. Typically, we are the recipients and the followers, and we have been good muqallids up until now. But now it's time to do tajdeed, right? To revive our tradition and to do ijtihad and to share knowledge with the rest of the world for them to benefit from what's contained within our rich tradition. So I'll hand it off to Sayyid Jamal, who's going to continue. And also I want to thank Sayyid Jamaluddin for the great job he did in moderation. Give him a round of applause. As well as all of the people who are behind the scenes with Sister Alia, Asra, especially Sister Sabika, who has been the heart of this conference. Let's give all of them a round of applause as well. جزاكم الله خيرا وآخر الدعوانا أن الحمد لله رب العالمين.
Jazakallah khairan, Dr. Humam, for those great remarks. And we're very honored to have this as an annual space for growth, both psychologically and also academically. We also want to welcome Hojam. Hojam in Turkish means great scholar or somebody that we appreciate and that we follow and learn. So Hojam, Dr. Recep Şentürk, we would love to hear some opening remarks. As you guys know, Dr. Şentürk is the Dean of College of Islamic Studies, Hamad Bin Khalifa University. Round of applause, please.
السلام عليكم ورحمة الله وبركاته بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسولنا وحبيبنا محمد وعلى آله وصحبه أجمعين. Thank you very much for inviting me for opening remarks. يعني this is a good omen that we are opening something إن شاء الله تعالى يكون فتوحات إن شاء الله في للمستقبل. I see that Allah made him say this, that we are opening a new work. Here we are starting here, but we are building on the work of scholars who worked on this before us. So this continuity is very important. And also we are trying to bring together everyone in the world, to contribute so that we work all together. I see that this is an ongoing work. It's an ongoing work, and it will never be completed. Otherwise, you'll be jobless. See what I mean? So we intellectuals, academics, philosophers always create new problems, new issues, so that people need us and appreciate our work. I see that this work will continue forever, inshallah ta'ala. And this is an exciting journey, and we will be in this journey all together, inshallah ta'ala. And CIS will be, inshallah, a center, or we hope that it will be the leading center, or at least one of the centers in the world, to play a key role in pushing this work further and bringing people together annually, inshallah ta'ala. This is what we wish, and may Allah make our journey fruitful, mubarak, bil futuhat, inshallah ta'ala. May Allah guide us and guide others through us. And we have a lot of things to do, and already, the presentations here set the agenda for the future, like what are the things that needs to be done, inshallah ta'ala. And but the beginning is half finishing, so we should be very hopeful and excited. So we have a mission, to fulfill. We have a goal to achieve, inshallah ta'ala. And there are people who have no goal, no mission in their life. It's better to have some problems. See what I mean? So alhamdulillah, we have some problems to work on it, to solve together, inshallah. And I believe that Western psychology has failed in solving even the problems of the Western societies. I see like Western society, American, European society suffering a lot, and they failed in their homeland. How can they come and solve our problems in a different society, in a different country? But this is true for all social sciences. Like people outside the West, they admire, Western social sciences. I tell them, which problem of Western society sociologists solved, psychologists solved? Give me an example. Economists solved. They're like it's a big, they are suffering from a lot of problems, and social science, I believe, useless, in their homeland. We should not exaggerate, their role. Of course, we will learn. We are open civilization. We learned, from other civilizations. We have no, complex in learning from them. Anything empirically proven, we are open to accept. But science is composed of two things: empirically proven facts and their interpretations. Empirically proven facts, we accept them, no problem. But when it comes to interpretations, their interpretations are theirs. We'll have our own interpretation, because those interpretations are based on worldviews. They are based on ideologies, and they, even among themselves, they have opposite interpretations of the same data. Why should we feel obliged? But they package them together and present to the outside world as if both are science. They are like magicians of the Fir'aun. So putting things together to deceive the whole world. So we should not be deceived. We should be fair but critical. Fair but critical. Fair to accept anything proven, evidence-based. Khalas, ma fi mishkila. But when it comes to like interpreting them in like a nonsense way, materialistic, from a materialistic perspective or egocentric perspective, this is not what we want. And the impact of psychology is very detrimental, poisonous, on many societies. Let me give you one example. Recently, someone shared a video with me. There is a psychologist giving advice to Muslim women. So he says Muslim women put their children first, husband second, themselves last. He says this is wrong. Put yourself first. Why do you neglect yourself? Put yourself first. Then the other people. this is very appealing, very attractive, right? And very tempting, seductive advice. I should put myself first. But put this in a broader perspective, in a long-term perspective. What happens if the wife puts herself first? Then the man will put himself first, okay? And the children will put themselves first. Then where is the family, okay? And later, when this woman needs help, who's gonna come to her help? She'll be lonely. Nobody will care about her because she did not care about the others, right? So it is her best interest, it is her best investment, not to put herself first. Put the family first, husband, children, friends, so that they come to her help later when she needs them, right? So when I heard that there is Ministry of Loneliness in UK, I could not believe. I said, this must be fiction, a lie, or something like this. I went to internet, checked. It's true. This is beyond my imagination. How can there be Ministry of Loneliness? So look at where they ended up by following this kind of advice. They pay to buy, to destroy their lives. It's like paying for the poison, to kill yourself. So do you want to end up like in Qatar or other Muslim societies to have Ministry of Loneliness in 10, 20 years? Is this what you want? Is this your dream? Of course not, okay? So we have to take measures, not to go in the same direction. Like our values is not egocentric. We are not selfish. Our life, our worldview is based on futuwa, altruistic perspective. And we do this for the sake of Allah, but at the same time, it's the best thing. It serves your best interest in this world at the same time. So, like for all these reasons, it's very important for us to revive our tradition. These problems have always existed everywhere. And in Muslim society, our scholars came up with many ways to deal with them. All what we need to do is rooted revival, without which we will be suicidal. Yes. Yes. Okay. And rooted revival can happen only through multiplexity. Multiplexity is the alternative to materialism. Materialism is uniplex. It reduces everything to the material level. But multiplex accepts that there is material level, and also the metaphysical level, and also the divine level. And there are multiple types of knowledge as well. Empirical knowledge, rational knowledge, and also knowledge we derive from wahi. This is what we call multiplex epistemology. And for every type of knowledge, we need a special method, and we developed it. So we are not against material perspective. We are as materialist as they are. The only difference is we are not reductionist. We are as idealist as those idealists. The only difference is we are not reductionist. We see that there is a proper domain in which you have to deal with material reality. There's a proper domain in which you need to deal with ideal reality. But what separates us is our holistic, comprehensive perspective. I call this ontological pluralism, epistemological pluralism, methodological pluralism. They have ontological autocracy, methodological autocracy, epistemological autocracy, monism. Either you accept only one level of reality or you are out. You accept only one type of knowledge, a single method as a scientific method, but we are pluralistic. And this pluralism is based on our understanding of reality. This multiplex ontology, I call it ontological pluralism and open ontology. And then open epistemology or epistemological pluralism. Those societies in the West, they are doomed to fail in their effort to create a plural society, because their ontology is reductionist, uniplex, epistemology is uniplex, and their methodology is also the same. They are doomed to fail in their effort to create any kind of pluralism. So our revival, our rooted revival, inshallah ta'ala, will be based on this multiplexity. So we don't create a dichotomy between Islam and West. We create a dichotomy based on ideas. Reductionism versus multiplexity. Uniplexity versus multiplexity. Pluralist ontology versus, monist ontology and epistemology. So this is better, because better than like putting Islamic psychology versus Western psychology. Say, multiplex psychology versus uniplex reductionist psychology. Avoid this pseudo dichotomy between Islam and the West. So today, West is everywhere, Islam is everywhere, inshallah ta'ala, and Islam is the fastest growing religion in the world. The number of Muslims are spreading. We are very hopeful about the future, although there are sad things that are happening at the same time. And I believe that you as psychologists, you have a key role to play, to protect Muslim societies, especially young people and children, from the attacks of those deviant people who are using psychology as a weapon. Jazakumullah khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Wow, that was amazing. MashaAllah. Thank you so much, Hojam, Dr. Rajab Shenturk. We are all very grateful for you opening up College of Islamic Studies and Hamad Bin Khalifa University for us as counselors and psychologists to be able to do the rooted revival under your excellent leadership through the multiplex worldview, and through a plural ontology, a multiplex ontology. May Allah subhanahu wa ta'ala accept all of your good deeds, Dr. Rajab Shenturk. And also we appreciate Qatar Foundation, and all those visionaries in Qatar who allowed this program to happen under the leadership of Dr. Rajab Shenturk. Round of applause, please. All right. We did like a call and response, Dr. Shenturk. You said rooted revival. I said without it, suicidal. So this could be like a new tune for our ambitions in Islamic thought, inshallah. It was amazing. Alhamdulillah Rabbil Alameen. I want to first and foremost thank all the viewers at home for being with us. We have had over 50% right now watching it, and that's a lot. I mean, it's a daytime activity, so many people are working. For all of you who couldn't be here, welcome next year. As Dr. Shenturk and Dr. Hamad Kishavarzi said, that this will be an annual gathering, inshallah. So all of you are welcome. I want to thank all the participants. Please forgive me for any shortcomings first and foremost. If I said anything wrong or did anything wrong, rest assured that all the mistakes are solid in mine. And if anything good came from my perspective, it's all from Allah subhanahu wa ta'ala, and all the mistakes are mine. So I want to ask for forgiveness, and please keep me in my du'as, in your du'as, so that I can purify myself and become a better brother of yours. I also want to thank all of you here for your questions. I know that you wanted to ask even more questions, so please forgive us. There will be more opportunities for questions in the near future. We will be in touch. I actually wanted to go to next slide. Please join the Islamic Psychology community on WhatsApp. ISIP, the International Students of Islamic Psychology, has a lot of WhatsApp group for resource sharing and discussions. We share resources on a daily basis, different organizations, different programs, different institutions. It's a free resource and sharing platform in many different languages. So this is the QR code, and you can join the Islamic Psychology movement. Also, please follow Hamad Bin Khalifa University and College of Islamic Studies social media handles. You see them on the right side. There's Twitter, or as they call X nowadays. I rather call it Malcolm X instead, because we like to follow Malcolm X, rahimullah. College of Islamic Studies on Facebook, on LinkedIn, and on YouTube as well, inshallah. So I will let this QR code and these handles be there. Please do follow also our co-organizers, Khalil Center's handles, and also International Association of Islamic Psychology. These are amazing organizations and initiatives. So I want to thank the organizers again. You have all the organizers there: Hamad Bin Khalifa University, College of Islamic Studies, Khalil Center, International Association of Islamic Psychology, and ISIP, the International Student students of Islamic psychology. Also, don't forget that there is an MA in counseling psychology going on here, and hopefully many other universities will come to take inspiration from the works here at CIS. So if you haven't applied, please do apply. And next year you can apply as well. So we will definitely advocate for this program. And as Dr. Shenturk said, this is the center of Islamic psychology, and hopefully we will have many multiplex centers as well, taking inspiration from the great works of CIS and HBKU, inshallah. I want to thank all the scholars. Please round of applause to all the scholars and all the presenters, all the moderators, all the counselors, all the participants and audience members for the amazing presentations and all the panels. I think we all brought a lot of gems that we will try to internalize in our clinical work if we're clinicians, in our studies if we are students, in our academical work if we are academicians. So alhamdulillah rabbil alameen. I mean, 1 hour is not enough. We need a lot of hours. So hopefully the conversation will continue on social medias and also through our suhbah and companionship. I also want to give a special thanks. Again, I know Dr. Human always said, Jamaluddin, you have this, but I will speed up, inshallah. So I need to really thank Sister Sabika again for her amazing work. Also Sister Alia, Sister Esra, Sister, let me not forget any names, Sister Medea, Sister Dania, and also Brother Hussein. I don't want to forget you, mashallah. He's a hip-hop fantastic. So Brother Hussein has done a great job. So round of applause to all the volunteers. And last but not least, after prayer and lunch, we will continue with all those who are the panelists and those who have been in the different discussions here on the stage. We will have a closed discussion table to further discuss how we can move forward as one movement, inshallah. So that will be at 1:15, and Sister Sabika told us to meet here in this auditorium, and then we will go to a different place, inshallah ta'ala. I think I brought most of the things. Yes. Let's make a dua to all of the predecessors, all of the scholars who opened up this field of Islamic psychology based upon the sunnah of the Prophet sallallahu alaihi wasallam and the sanad and silsila that comes with it, based upon all the scholars of our tradition who have dedicated their life and sacrificed their life so that we can sit here, stand here, and really reflect upon ilm al-nafs and Islamic psychology. Please make a dua for all of them. Let's make dua for Professor Malik Badr rahimahullah, because he is the father of contemporary Islamic psychology. I never met him personally, but I feel like he is a father of mine through the heart-to-heart connection. So make dua. Let's make dua for all of our predecessors and all of our scholars and all of the students. Let's raise our hands and just make a dua. We can do a silent dua, inshallah. Al-Fatiha. Let's make dua for all of our brothers and sisters in Palestine, all of our brothers and sisters in Ugaristan, all of our brothers and sisters in Myanmar, all of our brothers and sisters in Yemen and Syria and Iraq and Afghanistan and Sudan and Somalia, all over the world, all of our brothers and sisters all over the world. May Allah subhanahu wa ta'ala allow you to receive the support and help you need, and make your struggles a way for you to come closer to Allah subhanahu wa ta'ala and take away all of your struggles so that you can live in peace and prosperity. May Allah subhanahu wa ta'ala allow Islamic psychology to be the modality that will help all of our brothers and sisters who are suffering as refugees, as people that are feeling oppression, whether it's in the west or east or north or south. May Allah subhanahu wa ta'ala accept all of our deeds here as sadaqah jariyah to all of our predecessors and also to Professor Malik Badri rahimullah. Al-Fatiha. Jazakallah khairan. I will summarize by a rap, actually. I wrote a rap to summarize. And actually, I hope you guys will like. I need to start to record this rap, perhaps. We can do a futua rap with Dr. Shenturk and all others here, mashallah. It's a joy to be able to use, actually, just as a final remark from my side, I used to have trauma rapping because I left my former career many, many years ago, and I had a trauma. And actually, Islamic psychology came to my life as a way to allow Allah to heal some of the traumas in my past, and me and Dr. Rothman have spoken a lot about it. When I studied Islamic psychology, I wanted to leave my past, but through my studies, I came out integrating my past, but rooted in Quran and Sunnah, which I didn't have previously as grounded. So alhamdulillah, that some of the skills that Allah subhanahu wa ta'ala has blessed me with can be of benefit for the ummah. And this is all from Allah subhanahu wa ta'ala. So I hope you guys will like this one. Are you ready? I don't hear, are you guys ready? Okay, alhamdulillah rabbil alameen.
All right. Interdisciplinary will make it truly ready and steady. Revolutionary, no rather reformation in all occasions. Planning, mastering, deconstructing maqasid methodology. Planting, harvesting, reconstructing aqaid epistemology. Let us rest in logics. We were critiquing the Cartesian duality. Amnesia is what you see. Secular anthropocentrism. Ruhani emphasis is when the ruh gives us the clue of what is true, transcendence, mind, body, and soul. Yes, divine psychology is whole. Yes, unite so we can find the goals. Where our deen is not pathologized, and deen is what will make us alive. I am grateful and faithful for his psychology built upon mujahada, mukhalafa, muraqaba, break nafs amara to lawamaha, studied at the MA in CIS. Hamad Bin Khalifa, yes, that's so blessed. Jazakallah khairan, everyone. Without any further ado, please join our movements, and we'll see each other next year, inshallah. And I want to thank you all again, and let's have a great lunch together. Jazakallah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.